Today we are celebrating without any day, but with palliative care, which is the most important topic at present. As we all are well aware that in nuclear family, particularly in outside working family than the parents' house, it is very difficult to manage the parents at present era who have managed the son or daughter whole life, but daughter and son are unable to manage the parents. That is very difficult situation also. In that particular cases, in terminal illness where no option is available, I am confident that Ayurveda plays an important role. Ayurveda can cure, subside, and provide relief to the patient, maybe of cancer, maybe of any other disorder. So this is a unique subject. I am really thankful to Dr. K. Pandey ji of BHU who has introduced us with Anjali and Anita ji from Malaysia. Both are working in terminal illness, unique topic, as I said earlier also. So welcome, sir. To welcome all the dignitaries, I would like to request Vishnu Prasad Sharma ji, and before that, I would like to communicate my sincere thanks and regards to Professor Agnihotri ji, Madan Thangvelu sir. Welcome, sir. Welcome, Reddy ji, Sudhakar Reddy ji, Bhogia ji, Jagdishwar ji, Anjali Rajeevan. So, Vishnu Prasad Sharma ji, former principal, Government Ayurvedic College, Guwahati, and President Vishwa Ayurveda Parishad, Assam. Welcome, sir. Welcome for welcome address.
Okay, thank you. Good evening. Namaskar to everybody. Respected Professor Madan Thangavelu, respected Professor Dr. V.K. Agnihotri, Dr. Pawan Kumar Sharma, eminent speaker, distinguished guests, ladies and gentlemen. Today we have one important webinar regarding palliative care in Ayush. It is the most important, most interested subject. Though in India, it is not available in hospital or in anywhere. Few places it is available, but Ayurveda shows very good result in case of palliative care in Ayush. So today we have a very good eminent speaker, Dr. Kuldeep Kr Pandey, Professor and Head, Sanghaharan Institute of Medical Science, Banaras Hindu University, Dr. Anita Panda from Malaysia, Dr. Anjali Rajeevan, Kuala Lumpur, Malaysia. I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this evening palliative care in Ayush webinar. I welcome all of you. Thank you. Namaskar to all. Pawanji.
Thank you, sir. Thank you very much. Now I would like to request Madan Thangvelu sir. Welcome, sir. Senior Genome Biologist, Cambridge University. Welcome, sir. Welcome. Swagatam.
Pawanji, namaskar.
Today is the unique webinar, sir. Speakers are introduced by Dr. K. Pandey. I am grateful to him. He is Professor of Department of Sanghaharan in IMS BHU. I welcome him and really communicate my gratitude to him. And Dr. Anjali Rajeevan and Dr. Anita ji, both are from Malaysia, working on terminal illness. And this is the subject of choice of Dr. K. Pandey ji also. So just to inform you, Thank you. Thank you very much.
Pandey, namaskar. Thank you so much for strengthening our platform with your presence today. And I also want to especially thank our senior colleague, Professor Sudhagar Reddy, joining us from Bangalore. Namaskar, ji. The topic as
Namaskar, sir.
Namaskar, ji, namaskar. Very happy to be here. That as Pavanji introduced the whole area, there is a big gap, and there is a recognition though that this is an area where Ayush systems can offer. But before we pass the floor back to Pavanji to take on our speakers, I just want to put that world context on this. And as in many of our earlier presentations where I've been emphasizing the World Health Organization, I want to start with that and spend just a minute on this section on palliative care. I'll put the link to this in the chat box. So Pavanji has correctly said, life-threatening illness is whether physical, psychological, social, or spiritual. The quality of caregivers improves as well. So the estimate is that about 40 million people need palliative care around the world. And very large, almost 80% of them live in low and middle income countries. So there's a recognition there that this is a problem, and it's also a problem that needs attention, and only 14% of people who need palliative care currently receive it. So there's a big gap. So how do we approach this? In the area of pain relief, it talks about unnecessary use of morphine and all these kind of chemicals. And as we go in, it says correctly that palliative care involves a range of services delivered by a range of professionals that all have equally important role to play: physicians, nursing, support workers, paramedics, etc. It's into this kind of environment that we are bringing in palliative care from an Ayurveda and Ayush perspective. So in the context of what is happening in Jamnagar, these aspects that are recognized by the WHO are very important. Palliative care is required for a wide range of diseases. Majority of patients who need this are people with chronic disease, cardiovascular disease, cancer, respiratory problems, so AIDS and diabetes. Now, in all of these things, we are talking towards the very end of life care, for instance, or palliation. But within that continuum, we must also see how to integrate palliative care with what Ayurveda and Ayush systems can offer. So that's my first comment, that there is a recognition globally for this, and this topic is very important. Pandey might already know about these resources, and hence why he has brought speakers to the platform today. So Pavanji, these are just a few words from me in terms of why today's topic is so important. And as I said earlier, we want to make sure that these kind of messages get connected. So Pandey might already be thinking how to connect this with Jamnagar and happening in Jamnagar, how to connect this with what is needed in the country right now. We are a big nation in terms of population, 1.5 billion people. Although we are a relatively young nation, we also have our needs, and how we can fit that into that whole scenario. And what is it that we can get out of it from the India context and from the Southeast Asia region context for other parts of the world. So with those few words, Pavanji, I leave this with you. We look forward to our speakers today and looking forward to learning from you people. The structure, the format of our event generally is that we try and draw the event to a close by about 8:30 in the evening, India time, but it generally drags on till about 9 o'clock. And then depending on the mood of the discussions, having closed the event formally, we invite people to stay on and discuss whatever you feel is important for us. So it might drag on, but we will try and draw the program to a close by 9 o'clock. Another important point is that this is a platform for interactions. So please use the chat facility to put your questions and comments and thoughts and whatever you have into the chat box, so that we preserve these chats and we can keep it for reference for later. So that is another thing. So this is not a classroom teaching kind of environment. It's a place where we have come to share and, more importantly, come to learn from everybody. So please feel free. And the way we generally do this is that we keep all our questions and answers to the very end of the program, after the presenters have presented. But there may be an opportunity just to raise a brief question between speakers, if Pavanji permits. That is, he will guide us as we go into the program, keeping in mind the time available. So Pavanji, there we are. Thank you again for hosting the 381st webinar. And your energy and guidance is important for all of us, and it's brought us this far. Thank you, Ji.
Madan Thangabalaji, namaskar.
Vishnuji, namaskar, Ji. So happy to see you after so many days. We miss.
Yes, yes. I was busy with some meeting.
And I'm particularly happy to see Sudhakar Reddy Ji. Sudhakar Reddy Ji might have some comments, whether if Pavanji permits, we can hear 1 or 2 minutes from Sudhakar Reddy Ji, because we miss you very much in the platform. If Pavanji will permit 1 or 2 minutes, then could we hear from Sudhakar Reddy Ji?
Sir,
Sir, good evening.
Namaskar,
Namaskar, good evening. The point is this, that Dr. P. Sudhakar Reddy can be put some harjana, some charge for the discontinuation for long period. Why? Some harjana must be there. Not like the late fees. Some harjana is there. And important thing is, our webinar can be allowed for 10 minutes short nap, like Pavan Sharma ji, for a while. Thank you, sir. Thank you.
Sudhakar Reddy Ji, welcome. Thank you so much. You are all Swasthavrit people, and Swasthavrit has such a big contribution to all of these areas. If we take 1 or 2 minutes from you to set the mood for today's webinar, we'll appreciate that.
Sir, good evening to all. I'm sorry for not attending in so many days, because I was busy. Evening time, there were busy schedule in college, so I could not able to attend in between also. And I want to attend full session, but there is no time for me. And today I got little time, and that also palliative care. And I missed so many programs of yours, sir. Sorry for that. And palliative care, as my knowledge goes, it is very essential only through Ayurveda and yoga, only two. Because in modern medicine, especially like cancer, palliative care, in tuberculosis, palliative care, in all palliative care, only Ayurveda and yoga can do much more. There, the quality of life can be improved. Most of the patients in palliative care, they wanted only quality of life. And they know that they are going to survive only few days or few years, as mentioned by all of the doctors. But where we can give some hopes, we can give some Daiva Vipasa Chikitsa, apart from our Aushadhis also, that most important, and we can generate some hope in the patients by giving the confidence that where Ayurveda, Daiva Vipasa Chikitsa, and yoga, especially pranayama and meditation, that to yoga nidra, all these things will be helpful in palliative care. So only our aim is to increase the quality of life of the palliative care people. This much you can say, sir. I'll share later after the presentation. Thank you.
Thank you so much for sharing. Pavanji.
Thank you, Reddy Ji. Thank you. Thank you, Madan sir. I would like, before inviting Dr. Kuldeep Ji, Dr. Kuldeep Kumar Pandey Ji, I would like to inform one thing more, sir, which is unique today. Dr. Pandey has initiated this project to avoid any technical glitch. He has recorded whole lecture and motivated Dr. Anjali Rajeevan also. She has also sent her video to us. So we will play the video, and for question and answers, they are here, speakers are here with us. So first of all, I would like to request Dr. Kuldeep Kr Pandey, Professor and HOD, Department of Sangyaharan, Faculty of Ayurveda, Institute of Medical Sciences, BHU, Varanasi. Welcome, Doctor, welcome, and thanks. Thanks for today's webinar. Your voice is not coming.
Good evening to all of you. I am audible, sir.
Good evening, Kuldeep ji. Hello, how are you?
Fine, my dear. Respected Professor Madanji, Dr. Vinitji, Dr. Vishnu, and Dr. Pawanji. I'm very happy to learn that you are as much as eager and interested to highlight the problems of palliative care in medical armamentarium. And definitely from your forum, the message will strike to every mind of the Ayush and the medical practitioners what the problems we are facing now these days and how we can cope up with the problems through Ayurveda and Ayush medicine. I'm equally thankful to Dr. Anita and Dr. Anjali who accepted my invitation, and they have shown their interest to participate in this big forum. I would say that this is a very big forum and very academic forum because the task covered by Dr. Pawanji is really very appreciable and remarkable. Hats off you, sir. You have worked a lot, and that's why you have been recognized by the medical education system. Rather, I can say that this is a research in the every field of the Ayush and adults. So, a lot more has been mentioned by Dr. Madanji and Dr. Reddy. They have, in nutshell, they have focused the theme of the palliative care. I will not take a lot more. But due to technical issues, it was a bit late to record and transfer from transfer to Dr. Pawanji, and hardly I could succeed at 5:15 p.m. And then when he saw that your video is available, then I was relaxed. So this is from my end. And once again, I would like to express my sincere thanks for accepting this very interesting topic for today's webinar. With all these words, once again, I would like to express my thanks to all of you.
To all of you at this very renowned, very popular forum of this association. Before I share my experiences related to this topic allotted to me today, express my sincere thanks to the organizers, especially Dr. Pawan Sharmaji, Dr. Vishnuji, Dr. Vineet, and Dr. Madanji. I am equally thankful to my other two lady speakers of the day, Dr. Anita and Dr. Anjali from Malaysia. We all are working in the field of palliative care with our resources. And I think for Ayurvedic or Ayush practitioners, this is new to know about the palliative care and what it is. Before going to in details, I pay my regards to this great saint of the era. Whoever thought that integration of ancient wisdom and modern science application is the need of the health for our nation, rather you can say the need of the universe. So I pay my regards to this great saint, Bharat Ratna Mahamana Pandit Madan Mohan Malviya. Friends, I dedicate this lecture to my teachers, the supporting staffs, and my patients. Because without them, I ever thought that I can do anything regarding the palliative care. It was a dream. But they all supported me to develop my theme and to work on the principles of Ayurveda in the field of palliative care. No doubt, palliative care branch in the modern medical science is very late, and the journey started in 1994 when I met to Robert Tricos, who was the founder president of Palliative Care of Association of US. Then we discussed that what are the scope and applications of Ayurvedic principles and Ayurvedic doctors, how they can contribute in the field of palliative care, especially when there is no ultimate remedy for the cure. Because most of us not well aware about the palliative care, so according to WHO, they have coined a disease where the treatment is no longer responding because of the nature of the disease and condition of the patient. Sometimes while the patients are being attended by the doctors, there is a relief, and that relief is symptomatic, and that is support system, you can say rather. So what we do there, we care in toto to the patient and try to improve the quality of life of a patient, meaning that treatment is not completely fruitful to cure the disease, but we can care. And that's why care beyond the cure is the definition of the palliative care. And it is not only limited up to the patient, care of the family members even after the death of the patient. First of all, the Belfort he coined this terminology. He observed that many of the diseases are not being cured, but there are certain symptomatic responses of the treatment module, and patient can get relief up to some extent. So quality of life of a terminally ill patient can be improved, and the very same thing has been mentioned in the text of Ayurveda by Charak Samhita. You can find the reference. Before 4,000 years, they have a concept while describing the division of the defining the asadhya, incurable, they have categorized under the yapya and pratyakheya. Yapya means the disease which can be categorized under the palliative care. So, what are the basic aims of modern medicine people? What they are doing there? They are just to make the patient to stop the downward spiral of the life of the patient when he's thinking with the many more complications that they have to stop the downward spiral of the quality life and to make the patient comfortable at any cost and to make a pain free, because there are so many, this is not just a cut and a stitch pain, but there are so many factors of pain provoking, and to make the patient symptom free. Disease is one, and there are multiple system organ failure that causing the symptomatic disorders. And if you can cure and make a free from symptomatic disorders, that is one aspect of the palliative care. And to improve or to provide the better relief of to the patient. And ultimately, many a times a terminal patient is dependent on any family members. So the progress of the family or the progress of the country is being reduced. And while making a patient independent and self-esteemed is another aspect of the motives of the palliative care. Sometimes while making a diagnosis and making a treatment module, we think that this is because of the cancer-like disease or the incurable disease. But my dear friends, every symptom is not always due to the disease itself. Many symptoms are due to the multiple factors we have to consider. That's why in my previous lecture I have mentioned that we have to open eye for and observing the patient very minutely. We have to examine the patient's symptomatic disorders, and that too on the basic diagnostic tools as mentioned in the text of Ayurveda, Chaturveda Pramana, Triveda Pramana, and Dashveda Pramana. So on those very basis, we have to examine the patient and then assess what are the symptomatic disorders existing with the patient apart from the disease itself. While making a treatment module, don't limit the treatment simply to use the drugs. Drugs alone can't do anything because of the multifactorial aspect of the disease and multifactorial aspect of the treatment module. So we have to think over that. And sometimes the prophylactic treatment of the presenting symptoms is very much fruitful and helpful to the patients. So symptomatic disorders, prophylactic treatment and multiple system approach and considering the multifactorial aspect of the disease is foremost while making a diagnosis and making a treatment module. Then what is important to there? Don't limit with the single system medicine. Means each and every system of medical science is not completely that cannot be said that this system can cure all the diseases or all the sufferings. So we have to think about the others and never say that nothing can be done. Whatsoever I have done to improve the quality life, to cure the disease, that's sufficient and nothing can be done. No, never say like that one. This is the very ethics of the palliative care and application of multiple system approach. There may be medical or non-medical, counseling, music, yoga, games, indoor games, sports, even aroma can play a better role to cure many psychosomatic disorders. So that as principles of Ayurveda, we find that there is a mind and body relation. And if a psychological disorder is there, definitely there is a somatic disorder. And when there is a somatic disorder can cause the psychological problems. So considering all those, try to use non-pharmacological preparation up to some extent they are more effective. So what does palliative care means? Addition of the lives in days and not the addition of days in lives. According to principles or definitions of Ayurveda is Sarira Indriya Sattva Atma Sayogo Dhari Jivitam. Means a life is there when all these four factors are in equilibrium. Just like Samadosa, Samagnisha, Samadhatu, Malakriya. Then Prasannatmendriyamana means psychological factor and the somatic factors. They are uh, reciprocal, they are entangled with each other. So we have to consider all those factors, not only the systemic disorders or the disease itself, but the other psychological factors must be Indriya and Atma. They must be. We say that these are the Karmendriya and the Gyanendriya, but what are the factors? What are the constituents to make them? Is something different, and those are not visible by this naked eye. And that time we have to consider, and that's why I used to say a physician must have I4. Now the question arises, was the palliative care in ancient period? Was any disease which was incurable or the disease falling under the heading of the palliative care? Was any complete treatment during ancient period? Ancient period means the history when we came to know. Prior to that, was it there? And the problems in today practice, what we face, what are the problems with the patient, and what are the problems with the treatment team, how they are going to handle those problems. And now a very big question is, can we contribute? Yes, the disease was existing long back. There was no complete treatment, but relief was there. We are definitely day to day feeling problems while handling the different types of the patient, especially cancer terminally ill patients, HIV, AIDS, and the hepatitis-like patients. And then there is a large scope to contribute for the AYUSH practitioners in this field. And that's why I have come to say that each and every discipline of AYUSH must join this and try to their place how they can contribute to help the poor sufferings. Now, what are the problems with those when they are their life becomes taboo? They feel there are some physical problems, disease itself is creating a lot of problems, systemic and other problems. Definitely, there is some emotional factors to the patients, even with the patient and with the family members. And then psychosocial problems. A patient suffering from the terminally ill disease, he is in a corner of house. Each and every member, they have gone out of the house for bread and butter, and he is lonely there. His social uh, relations are limited, and then definitely there is a psychological problems. All these factors, they strike the mind of the patient, and then the patient start thinking about the spirituality of the religion. Then he start thinking that my neighbor is doing a lot of sins, but he is so happy, but I am giving a lot of love and affection and services to the poor sufferings. Apart from that, I'm suffering. So he loses his spirituality to the religion. And all those factors, physical, psychophysiological, sociological, emotional, spiritual, they all try to pinch the patient, and sufferings they precipitate, and the patient uh, start feeling the depression, anxiety, and apprehension. But when the patient comes to us, we look only one thing, that is the what is the biopsy report, what is the laboratory report, and according to that we are going to treat the patient. But that's not enough. We have to think all these four factors existing with the patient apart from the disease which is underlying. Then definitely the patient starts psychophysical depressions, because on one hand the chronicity of the disease is increasing gradually because of there is no response of the treatment, and no doubt the ill effects of the treatment are standing there. So on one hand, we are going to treat the disease, causative factor of the disease. Other hand, the treatment modules, they are giving problems to the patients. Say for that in a cancer patient, while we are treating a patient with the four, first one is the surgical, then chemo, then radiation, and now coming to the immunomodulations. So all these are having some sort of ill effects, and patient on one hand we are treating the disease, but it's not being cured completely. Still, in interest that treatment module is giving this ill effects of such treatments. Then definitely there is a psychophysical and social unrest, economical unrest, and overall these three give rise to the multi-system organ effect. So disease is one, expelling the effect over the other systems which are not related with the somatic disorders, but psychological problems, economical problems, social problems, religious problems, and ill effects of the treatment modules and chronicity of the disease. Over and all, patient sinks into a great depression. So we have to take into proper consideration while we are going to handle a patient of terminally ill. Then coming to the what are the diseases which can fall under the heading of palliative care. The disease itself is incurable, and patient gets some relief by the symptomatic treatment, and but it aggravates shortly and produces anxiety, uneasiness, disorders of the consciousness, and gradually there is a multiple system organ failure and ultimately death, leaving behind the pain. With the pain, patient dies with the pain, patient leaves the pain in family and the society. So these are the diseases which are definitely incurable, but we can provide a pleasant life, and we can add life in the rest of the lifespan of the patient. That's why this is a palliative care. Many symptoms you may observe in a patient related to GI systems, genitourinary system, psychophysical system, and hepatobiliary system, and cardiorespiratory systems, endocrinal system. So all systems, they become gradually sick and sick, leaving behind. Sometimes you will not find any visible injury to the patients. Say for that, a patient came to me and said that, Doctor, last week I was feeling very well, but after that, I'm unable to take my meal, two breads or three chapatis, and now it is difficult to get one. And I have no interest while to take my breakfast or the dinner and lunch. So, but there is no visible pain like an assault or like an a cut and a stitch and injury. But there is a invisible injury which causes the pain to the patient. So unrest and discomfort realized by a patient not only because of the systemic disorders but their physiological functions and their unrest or alteration in day-to-day daily physiological activities of a particular system. They may develop newer and newer problems in a patient which is not bookish. So you have to think about those problems while making a diagnosis and treatment module. Sometimes patients comes to us with a small story which is visible or can be observed or can be analyzed by laboratory and others, by history, but a large story inside the body and mind is still inside the patient's, that is like an iceberg floating on a water. A small story we can learn, but a large story inside. We have to analyze, we have to find out that largest story or a biggest story of body and mind inside the patient's body. So this is very important when we observe such a small story in a patient and find that this symptom is sick because of this disorder. Because of the laboratory finding, they are supporting the questionnaire is supporting, and the observations by examining the patient is this much only, but that is not enough. Then we have to observe patient very minutely to get uh, concrete information from that sickness. Many patients used to come say that I'm your regular customer, my dear pain. At least discount me in my pains. This is the version of a patient who is asking to, requesting to the Lord pain, and that pain is the King of the kingdoms. My dear friends, while we are going to specify the pain of a patient, which may be physical, psychological, social, spiritual, then we have to think that this very pain has many threshold factors. The very same intensity of the pain is different in different individuals, and that is according to principles of Ayurveda, means they and manas prakriti of the patient be considered while thinking about the painkillers. There are many more drugs. There are many limitations to use those drugs. Sometimes we can't provide, we can advise the patient to take it orally, injectable, and liniment. And there are many alternatives, no doubt. So we have to think about the alternatives of the painkillers according to the patient feasibleness. And no doubt this is a very big question why majority of the drugs, synthetic drugs used by modern people, they are not devoid of any untoward effects. They are full of untoward. While we are going to cure the patient's pain, somatic pain, and meantime patient is not taking proper meal, and we are advising this NSAIDs and other things. Definitely the patient will suffer from the GI upset and hyperacidity. Same thing happens with the potent analgesics by which the other analgesics are being tested, that is the morphine and its derivatives are used in palliative care for the pain management. And that time we find that while using this drug, gradually there is a drug abuse, constipation, insomnia, giddiness, dizziness, and so on. So, on one hand, we are going to treat a patient's pain, but we forget about the fundamental principles of Deha and Manas Prakriti, analyzing with the Tridosas component of Ayurveda that how the Ayurveda is. They are supporting that if it is Vatas, the diseases of Vatajasthana, and disease nature is Vatas, and Prakriti of the patient is Kaphas, then the treatment module is different. So we have to consider all those in principles in respect of the Ayurvedic fundamental principles of the disease, and the Sattva Kriyakal is very much essential to analyze or to applicate here. In a terminally ill patient, what happens? Gradually, there is a decrease in the immune power. Vyadhi Kshamatva is decreased gradually, and when there is a metabolic function of a patient is decreased. That's why while defining the definition of Samadosa Samagnisha, means that what are the building materials, either this may be Trigos or Panch Mahabhautik, they are the building materials of the unit of the body, that is the cell. And there is a metabolism inside the cell, and when it is distorted, deteriorated, the metabolic function will gradually decrease. Then how we can presume that this very person will be healthy, and according to definition of the swasthya or health of a patient. Then when immunity is decreased, definitely the power to fight against the disease is decreased. Metabolic function, the force or the energy inside the body is decreased. Definitely there is a decrease in the quality of life. Because while there is no energy, then it is very difficult to think about a physical movement of a patient or the freshness in a person suffering with a disease. So quality life is to be maintained by enhancing the immunity and improving the metabolic functions. And when all these three are there, definitely there is symptomatic disorders. If energy is not there, metabolic function is reduced, appetite is reduced, MNT is reduced, definitely the patient will not be able to move, and there are chances of bed sores. So these are certain examples by which we can understand very well what the patient's problem is there. So we have to think how one started or one started to affect the other system of the essential factors for the life and the health. So the challenge arises in front of us that there is no response of the treatment, unrest is there, quality life is poor, so patients start losing faith in God and religion. This is the very big problem, and the AYUSH has mentioned that this should be considered. And many times we forget about the principle diagnosis and treatment module, then we forget about all those factors, because whatsoever treatment we are going to provide a patient is not responding to the patient at all because of the poor condition of the patient, poor metabolism of the patient, and the chronicity of the disease. There is no specific treatment to kill that causative factor or the vector. So definitely there is no response of the treatment. So this should be considered. These are the problems. So what should be our approach to cure a patient? That is not possible. Then restore the function. Sometimes we can restore the function by systemic support, and we prolong the life. Mind it here that the prolonging of life means with the quality life, not the diseased life. And then patient requires comfort always. Even though you have cured the patient, try to cure the patient, restore the functions, and improve the quality life, but there should be always be a comfort to the patient, and that is mandatory. So, my dear friend, these were the modern concepts of this palliative care and the palliative disorders and the palliative sign and symptoms what we find according to WHO. Now, what Ayurveda say, when Ayurveda says that Ayush system of medicine says that when there is a incomplete cure, but we can cure a patient according to fundamental principles and approach of the treatment. We can provide this one. Prior to that, we have to
Please bear for 2 minutes only. The network problem is there. Please bear for 2 minutes only.
say that, but that the you
Vijay, is this problem in the recording or is it?
No, it's not recording, sir. Its computer is shifting to another internet network.
Achha, achha, achha.
Just 2 minutes. Just 2.
Thank you. नवीन जी प्रणाम. आज हमारे साथ बग्गा जी भी
सर,
है.
नमस्कार.
नमस्कार. गोगिया जी नमस्कार जी. रवि जी
थैंक यू सर.
आज हमारे साथ है डॉक्टर बग्गा, सुधीर बग्गा जी. नमस्कार बग्गा जी. नमस्कार. Pandey ji, apologies for this.
No problem. That's why I have sent it as a pre-recorded.
हाँ जी, आ गया जी.
To face these problems.
In a particular criteria, in a particular environment, this disease may fall. For that, you have to follow this regime according to seasonal variations. Ayurveda is a culture. Psychophysical happiness is the culture. Culture is not just a symbol to celebrate Holi, the festivals, Holi, Diwali, Dussehra, New Year. No. This gives a lesson, that is psychophysical. We used to meet with each other and we celebrate, and then we feel that we are happy. So psychophysical happiness as the culture is mentioned in the text of Ayurveda. Then Ayurveda is a religion, and that religion is Vasudhaiva Kutumbakam. We think about the health and happiness of the whole universe creation. And that's why Ayurveda in the last says that someone is there who is looking after you, who is insisting to you to perform according to the principles, to perform according to the need, just for the development of a nation, for the development of newer generation. This is Ayurveda. And nowhere you will find that this type of definition or this type of themes which are completely incorporated, or you can say that completely mentioned in the text of Ayurveda in different references, you will find that this is, and that to be applied in our society, patient sufferings. And when we follow this one, definitely we will live with the Ayurveda. This is a reference. There is a font problem, but where it is mentioned, when I came to Robert to know about Robert Tricos, he said that this is palliative care and very new branch in the medical armamentarium. Then I asked him, sir, this is mentioned in our text of Ayurveda, and that what are the definitions you are trying to convince me? It is very much mentioned 4,000 years back. Then he asked me, yes, if it is, then show me. Then the next day I went to him and showed the reference. Then he said that you have to work on this very, and definitely the society will be benefited, because there are a lot of problems making the diagnosis, making the treatment modules, and to make an overall care of a patient. That is Ayurveda is better, and that was his words. So this I have taken from the text of Ayurveda, that is Charak Samhita. Shresh dosatvad ayuso yapyam asadhyam path sevaya labdhalpa sukham alpena hetuna supravartakam. Means if lifespan is there, and when we use some symptomatic management, problem relieving management, but because of any obnoxious or untoward situations which are not feasible to the patient, the disease the disease may precipitate in more dangerous conditions. So this is when that disease develops with the chronicity and it spreads sthana sansraya, then pressure sthana sansraya. When it goes into uttarota, successive dhatus are building materials, and deep-seated disease, asthimajja. That's why the bone tumor or bone carcinoma or osteosarcoma of a patient is incurable. According to principles of Ayurveda, if the disease goes deeper, 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 then it becomes difficult. And when it attacks or it gets situated over a marmasti sandhi, means where there is a multiple system, vital systems are there, and the disease get accumulated there, definitely the disease is incurable, and sometimes asymptomatic relief can be provided to the patient with the alternative therapies. That's why it is under the category of incurable disease, but that is palliative. What happens when a patient is suffering with the palliative disorders? Uh, According to principles of Ayurveda, the three-dimensional treatment, first of all, is to remove the causative factor, which is not possible because disease already precipitated there, inoculated there. But the improvement in the metabolic energy, that is Agni Chikitsa, because we know that Agni means Samanvayu, Pachak Pitta, Aulambak Kapha, that is in the area of the gastric zone, and when there is a sick liver, it will cause, means the ill effect of the treatment, whatsoever ill effect of the treatment is there, poor health is there, stress is there, and socio-economical unrest is there. So disease has been progressed, and over detoxification is not properly there, immunity definitely will decrease and the quality of life will decrease. So second aspect is to improve the metabolism, and that way the samadosa, next samagnischa. Samadhatu is later on, means the cell which is the unit of the body, and Agni means the metabolic energy or metabolic function of that cell, which is responsible to get the development of the seven dhatus and gradual in successive manner. So when the Agni means their metabolism itself is distorted, decreased, altered, definitely the neither there will be detoxification, neither there will be proper metabolism, and there will be decreased immunity. Definitely, you can think very well what will be the quality of life of a patient. So, application of the principles of Ayurveda is very much unique here, and that can be utilized. Then, coming to the concept of the treatment, or you can say the care of a patient, there are tri-dimensional module of treatment of Ayurveda. First one is the Daivabhapashraya, second one is the Yuktibhaprashraya, and third one is the Sattvavajaya. These three-dimensional treatment module is very much useful while making a treatment. But prior to that, one thing I would like to send my missus there, it is not always required to be a doctor or a member of the medical team. A person who is terminally, this patient was executive engineer and because of this terminal disorders, you can say that what is the psychophysical unrest, and the picture of a patient is self-reflecting the problems living with the patient, and what the impact of the patient in the family. A millennial has come on this floor. You can see that what are the socio-economical, financial, spiritual, and so many factors which are leaving impact over the family other than the patient his or herself. So these are the problems with the patient of a terminally ill. How? When we started this palliative care work, ideally from to 1994, then after 2000, I came into contact with the Department of Radiation Medicine and Radiotherapy, and I must thank to them that they have provided me up an opportunity to select the patients and utilize our principles and drugs according to Ayurveda. And it was found that minimizes the untoward effects of the treatment modules or the well-known side effect of the chemo, radio, immuno, and surgical interventions. Sometimes it minimizes, or you can say that many times I found that there is a complete cure of the symptomatic disorders. And excellent result was found in the correction of the metabolic dysfunction when the SGOT-PT was more than 3-4 thousands. After 1 month treatment, it came to the normal values. And when a patient feels better, definitely there is psychophysical imbalance which was not there. A patient was in anxiety, apprehension, dryness, mouth, and so on. It was improved there. And very well known to all of us that even modern people, and thanks to Corona, who has showed the mirror to the society that Ayurveda has many more drugs and that can improve the immune system. And definitely, when I used to treat my patients, I found that there is a definitely improvement in the immune system of the patient. And once there is an immune system is improved, definitely a lot more diseases can be cured and improve and restore the quality life. When all these factors what are mentioned in above are responsible for the quality life, and that can be achieved even though it is now. I used to say that I can't treat, I can't cure the cancer itself, but I can help to improve the quality life. I can help to minimize the untoward effects of the treatment modules. I can improve the metabolic dysfunctions or psychophysical imbalance can be corrected with the help of the fundamental principles of Ayurveda and the drugs mentioned which are suitable to you. And that is the motive of this. But prior to that, one thing I used to come to my patient that what they used to demand me, they need the proper and adequate analgesia. It may be psychological, it may be somatic. They want to be mixed with the society. They want a friendly behavior. Many a times my patients, they ask me, sir, can you give me your contact number? As and when I require, I can chat you. I used to provide them. Even midnights, they used to call me that, doctor, I'm not feeling well. Can you suggest me what can I do? Yes. When you are a friend, definitely you have to behave like that one. Then healthy family environment you have to create. You have to educate the family members that try to maintain a healthy atmosphere to the patient. And natural living is very much essential. Not if you the patient is not living naturally, definitely he thinks that he is burden on earth or the society or the family. And overall what the patient demands, that is the satisfaction. Satisfaction is the foremost important factor while you are going to handle a patient of the terminally ill nature. Then how you are going to be successful? First of all, you have to listen properly. It may take time. If you don't have that much, you don't. and you can't get the success. But gradually, many times patient used to come with the written application like this one, sir, this I'm having such problems, and this was yesterday, this is 1 week prior, and I had a lot of problems. Then I used to listen while I used to observe their facial expression while explaining their complications or the complaints. Then think that what are the severity of that complaint. Then after listening, we have to give a better explain the patients in his or her own language. Then try to find that whether whatsoever you have transmitted patient has learned or not, understood or not. Simply explaining is not matter. You have to think, you have to check that what you have explained patient is following or not. Then after these two, you have to maintain a positive rehabilitation setting, and that must be suitable to the patient. It is not like universal to writing a pharmaceutical company's prescriptions. No, not at all. Many times you can find a large number of drugs in the periphery of the patient. You just find the area where the patient is coming from, because Anup and other climatic areas, what the cultivation of the herbal drugs may be there, and which form, which first form can he get. So all those must be taken into consideration, and then this principle must be followed there, otherwise not. Then where you have to focus? First, nutrition. You have to provide the good energy, and this good energy after the Agni treatment, metabolic improvement. When patient starts having a good nutrition, definitely the battery is charged and patient is going to be immune. Then mobility. Patient must be moved, not bedridden, because stagnation is not the characteristic feature of the life. Life means you have to move, you have to run. Then improve the mood of the patient, and then independence. Make a patient self-esteem. He could perform his daily routine. Make the patient, assist the patient, try to help the patient in that very direction. Then what should be there? The treatment module must be relevant to the patient, comprehensive. That must be excellent and multidisciplinary. It is not that the patient is upset, is not taking meal, but you can switch on your transistor and ask the patient which movie is and which song is your favorite ever. Then try to play that one, and then observe what are the feelings of a patient, what are the mantra chanting is there, and how he is going to involve in that. So multidisciplinary. What the problem of the patient is not able to take any painkiller, and joint pain is there because of the long lasting bedridden. Then have a help of the physiotherapist. He will come and give some exercises, and patient will feel better. Then that treatment must be consistent and continuous. Not there must not be any interruption, and well coordinated. That must be well coordinated. There is coordination between the palliative team. If you are not able to attend the patient, your any person of the other specialty or the same specialty or medical or non-medical have to attend the patient to cure the patient. Then coming to the spiritual therapy, Daiva the first foremost mentioned for the treatment module. When patient starts thinking that loss of faith in God, there is deviation from the religious act, means patient is towards the psychophysical depressions. Then Dharmopadesha is the only way. And that time many sorrows can be washed out, and how it is going to help, because the Vedas are not just a text of Hindus. Vedas, any holy book of any religion that is worshipped by that society. And every religion has mentioned the philosophy of life and death. And then faith, try to inculcate the interest are the faith in the God and try to motivate the patient in religious act. Can you imagine when any one of our beloved is we lost there are certain rituals, and with that rituals we care the family members even in the death of the patient. It decreases the sorrows and pains led by that victim of the terminal case, and that time it improves the quality of life of the patient if he is alive, and the family if the patient is died. In all those sense, the chanting, the discussions mentioned in the Vedas, holy books of the religions, where the patient has lost the faith in God and religion, that can be shared with the patient. How it is going to help? It is drugless therapy. Definitely, there is no need of a metabolism, detoxification, and the eliminations. It provides the peace of mind, enhances mental healing, reduces stress, improves quality life, and emotional support is almost required. When there is a mantra chanting, then there is no expenditure of the drug purchasing, there is no side effect of the drug, there is no any foundation to take it orally, injectable, or in other ways. So the Vedas are drugless therapies in terminal patient, and they are harmless. Then coming to the second aspect, that is objectively planned therapy, yukti bapashya chikitsa, means you have to design the treatment module, that is use of specific medicines, potent analgesics, symptomatic disorders relieving medicines, improvement of the metabolic activities, good dietary regime, use of rasayanas, and ultimately use of good code of conduct. It is mentioned in the text. I'm not going apart from that Ayurvedic text. All these things are mentioned in our text of Ayush. In my experience, what I have found that I had tried to combine the analgesics and the media drugs. On one drug is minimizing the untoward effect, and dose is reduced of the analgesic whatsoever patient we are taking, and to minimize the stress or the psychological problems or induced disorders, there is insomnia, and that time media drug is effective. So many more drugs of these two categories, Vednas, Thapan, Vednas, Samaksul, Prashman, and Midhyas, can be selected. Brahmi, Ashwagandha, Sankpuspi, Amalki, Guruji, Tulsi, and so many drugs I have observed clinically on objective and subjective parameters. Biochemical analysis was there, and I have found there excellent results in psychophysical response, and that uh, this metabolism comes to second hand, that is the improvement how metabolism is, and the diet can help a patient. We simply say that this balamarogyam ayusham pranasya, and means bala. What are the bala? Bala means not the physical power. It is physical as well as the mental power. Arogya means when you are highly immune, you are in good health. Ayushya, quality of life, and prana, longevity with the proper vital function. Then only we can say, because yavat prana is there, then the life is there. If prana is not there, dasayu aitanyahu prana yesu pratishtha, means your 10 seats of the pranas are there, means they are the most vital sites from where each and every systemic functions are being controlled, governed, and they are maintained in harmony. So when there is a proper diet, there is a proper metabolism, all these four factors which are very much essential and important for a quality life is there. Use of media drugs. Media drugs means the dhriti smriti is the basic characteristic features or the pharmacological properties of the media drugs. They reinstate the positive mental makeup. They revigorate the physical performance. They revive the social activities, and sometimes they try to cure the insomnia-like disorders. Herbal anxiolytics, what I have stated earlier, I observed on an EEG, EMG, bispectral indexing, catecholamines, sugar, and the cortisol level. In my study, I found that the uh, quality life of patient was improved, and the I would like to quote here the scale designed by Padma Shri Professor IRES Singh sir. He had designed the OJS negative scale, and while observing my patient on that very scale, I found that these drugs are very much effective, and the principles what I have used in treatment of the palliative disorders, I found excellent results were found. Then the pain of any type, psychophysical, and the insomnia are psychological, can be cured with the herbal analgesic and media drugs. They are improving the quality life, quality metabolism, and the improvement in the quality function of the body. And definitely there is an increase in the immunomodulation. And I used to provide all these formulation in different ways to the different patients at different stages of cancer or terminal ill. And that too, along with the conventional cancer therapy, you can say that the chemotherapy and radiation medicine. How rasayanas are important. This corona has given that rasayan treatment of Ayurveda is very much effective for the longevity, free from disease, memory enhancement. And in corona, post-COVID symptoms, it has been observed there is a insecurity, feeling of depression, feeling of irritation, and that I used on those patients the rasayana therapy found better. Youthfulness, power, excellence of luster and voice, modesty, brilliance, optimum strength and physique, and optimum strength of the sense organ. Means Atmendriya mana swasthitya bhedi. So the physical, physiological, psychological, and spiritual all aspects are being maintained with the use of the rasana or promotive therapies. Other adjuvant drugs are there, nutrients, weight promoters. These are mentioned in Panchashat Mahakasaya chapter of Charak Samhita. And you will find there are a large number of drugs you can pick from them, and according to need of your patient, according to category of your patient, you can pick any of 10 and then use and formulate as and when it is required, or you can. Then lastly, the third concept is Sattvavajay Chikitsa, means the psychological therapy, and it is very much. One of my friend, Dr. Gopal Vasist, practicing as a symbiotic physician in Texas, when I met him 10 years back, then he explained how the symbiotic approach of Ayurvedic and modern medicine is there, and the amalgamation of the uh, these two Ayurvedic system and the modern medicine, drugs of Ayurveda and modern, can help a patient with the better safety and better results. So developing quality of mind for freedom from disease is the characteristic feature of the Sattvavada Chikitsa. Application of, you can use the application of yoga. My few students are PhD, they are working on the practices of yoga and their impact over the terminally ill patient in last terminal stage, you can say the third and fourth stage of the cancers. Then interesting game just to divert the patient's mind from the disease and other components patient involves, and try to make a victory of a patient while playing with a team, and then observe the pleasantness of the pleasure of that very patient, that he's knowing that he is now of no longer span of life, but he thinks that before that I won the game. So you try to develop that one. Then if he is interested, you provide the videos, video games, music, and the library, and overall the counseling is the best. So you must be a good counselor there. Try to snatch all sort of sorrows and pains from the patient, and then you are a good counselor. And over and all, love and affection is very much required to a patient of terminally ill. So symbiotic human touch is there, and that is from the Sattvavajay treatment and the psychological therapy mentioned. My dear friends, when you are alone in your family, then observe the experience of taking meal alone. And when you are not that much rich, but you are enjoying on a dining table with your family and friends, this is the message of psychological history. And then observe that nothing would be more tiresome than eating and drinking if they are not a pleasure as well as a necessity. That's why it is. So social mixing is friendly behavior is very much important there to take to care the terminal patients. Then application of aromatherapy, again the problem of the font. Trembakam yajamahe sugandhim pushtivardhanam. This is the version mentioned here, and how aromas are very much helpful. My dear friends, you observe when you used to go in a party, picnic, or any other place, or you when you are going to worship your Lord, and when you are going to sleep and bed, then you try to improve your some cheerfulness by using the aromas. And how aromas are helpful? They are just to inhale. They are not either you rub on your skin, they will show their effects, but they are not that much harmful to anyone. Uh, Rejuvenative, beneficial to health, elevates mood, cheerfulness, strength, improves the vital function, reduces the induced disorders, and relaxation of mind and body. Antidepressant action is there, and the analgesic properties. Sometimes it provides the rehabilitation and the non-invasive therapy. So aromas are very much effective in those subjects. Then, before going to select a drug for objectively plant therapy, you have to select those drugs which improve the asthenia and anorexia, release constipation, because that is more common in terminal patients. Then rasana therapy to build the immune system and enhance the memory and cognitive functions. Then anti-anxiety, good analgesics, anti-cancerous, freedom from the drowsiness and antidepressant. These are certain criteria that can be taken into consideration while selecting a drug for formulation of a treatment module. So how Vednahar and analgesic and nootropics can they perform their actions? They are good in anti-stress adaptogenics, safe at any age, minimize the analgesic dose requirement. Many times I have found the patient was taking 30 mg of morphine TDS, but at present, after 2 years, the patient has stopped completely taking morphine. Gradually, they reduce the dose of the morphine. And so the herbal analgesics are very much helpful in this. So provide sedation and tranquility, provide analgesic, provide better outcome when we use herbal analgesics and this Vedna Dravyas. So our focus area is to improve the immune system of patient, to provide certain analgesic effect if it is, then provide the antidepressant. And depression is foremost problem in a patient when he is suffering from the terminal disorders. So you have to think about what are the antidepressant pharmacological, non-pharmacological, and their feasibility according to the need of the patient and condition and economy and the other situation of the patients. So sometimes there is a chance of insomnia because of the psychophysical disorders. There is anxiety. Many more drugs are mentioned in our text that can be utilized. So over and all, the correction of the metabolism is very much important here. Once you have corrected the metabolism of a cell, then definitely there is a formation of the good successive tissues, or you can say the dhatus. When the tissues or dhatus are in a good and better productivity, definitely the health will be better and the patient will have to good confidence in the health. Our problems, what are the problems? Like a terminally ill patient is like a hut which is distorted by a storm, and when we have to provide the patches here and there, then definitely that will provide a shelter. But that is not ultimate treatment. We have to come together, make a collective effort what we can, and then think the vision what you can achieve. Right? So first we have to think the problems, come together, and use the help and take the help of the other specialties and then try to achieve this goal. So that can be achieved with the positive approach, not beyond that one. So this umbrella care, I have designed this one for my patients, that you have to take the Ayurveda, help of Ayurveda, allopathy, yoga, Siddha, Vedas, Unani, aroma, cultural, spiritual, sports, psychological, music, homeo, socio, natural, all these. Those who are doctors are medical personnel, those who are not. But you can take their help to treat the multifactorial disorders of a patient and multi-systemic disorder of patient and multi-psycho, physico, physiological problems of the patient by providing this umbrella. Each and every spike of umbrella is a system, is a pathy, is a subject that can be taken and their help, and then you can think about the care of a patient beyond the cure. And this only is the umbrella of the Ayush. So what is the Ayurvedic approach? It strengthens the immunity, it is efficient in detoxification. It's responsive to minimize the inflammatory lesions, provides optimal metabolic functions. It balances the regulatory function of the vitals. It enhances the and regenerate the damaged tissues. It harmonizes the life forces, and naturally, all over world, it has been come into existence last 30 decades that there is a free radical scavenging or antioxidant properties. So all these are rich in Ayurvedic, and so we have. Why don't we take the help of the Ayurvedic principles and Ayurvedic formulations? So definitely having this much vast, fruitful properties, qualities, we have to utilize that one. Because our purpose is more important than the need. Our purpose is to provide a good relief, excellent quality life to a patient in a terminal stage. Because in a race between lion and dog, many times deer wins, but lion runs for food and deer runs for the life. So we have to run for the life that is quality life. Maitri Karunyam Arteshu Shakke Pritrupekshanai. These are the characteristic features of a physician, and that must not be forgotten by us. Nowhere it is mentioned except text of Ayurveda or the Vedas. Because unless you are not having any Samvedana, it is difficult to read the Vedana of the patient. And no pathy is complete deprived of sympathy. So if you want to have, if you want to create a patient, then have some Vedana and sympathy, Maitri Karunyam with the patients, then only you can. When I started this palliative care unit, this is the unique unit in my department. And when I established this palliative care unit in Department of Sangya and BHU, this is the first and ever in the history of the world that palliative care unit is running very good in the department, and that is in the faculty of Ayurveda, and that is Banaras Hindu University. That is the vision of Mahamuna to amalgamate ancient wisdom and modern sciences to cure the disease, to cure the sufferings, and to help those people, those who are in real need, and that we have started. And the blessings of the then Vice Chancellor, Professor G.C. Tripathi sir, he inaugurated that one. So drug is not enough complete. Spiritual and physical health are equally important. So we have to think about the holistic approach of Ayurveda and realize that can be achieved sometimes by the drug and sometimes the tridimensional module of the treatment, as mentioned in the text of Ayurveda. So, my dear friend, sympathy and samvedana can cure the patient even though they are in terminal stage. But if you are having samvedana, look a smile over the face of the patient and observe that patient is taking milk when it is not able to take anything or not able to swallow anything, but he is taking because, and how think there how he is holding the hand of the nursery care taker, that he is giving the blessings to the patient. He is giving that human touch to the patient, to the doctor or the whatsoever is there. So look the how it affects the psychophysical impulses. They are improving the systemic disorders that has been developed in the terminal patients. I used to go in ashrams and where the patients are there and they are unable to come to my OPD or hospital. I used to go there and to serve them. Sometimes they are suffering from the joint disorders, unable to move, and sometimes they are poor metabolic problems. Then my single visit is sufficient to them. They the cheerfulness what I used to observe them, that is very much encouraging to me. They are my patients, CA esophagus. I haven't seen the patient. It was only on telephonic conversation. Now she is fine, having the CA esophagus. Was not able to swallow anything, but now she is quite fine. I am passing the life like a normal person. This is a squamous cell carcinoma of oral cavity, and now is very well. This MR after MRM, wound was there, Agni Karma and dusting of Madhuyasti and the extract of the marigold. The patient is now cured. This is a patient came to me from the Nepal, having swells carcinoma of the buccal mucosa. Now you can see the result after 3 months. And this was patient of spine tumor, was unable to move, and she was a burden on family. When she came to me on a stretcher and they asked me that give some Ayurvedic tonic, I am going, and the doctor has refused. Now the patient is on her own legs. She is moving here and there, attending her husband, and the patient who was on bed, but now she is quite fine lady having a marketing. These are certain pictures of carcinomas and their problems and systemic disorders. The CA colon was there, operated, colostomy was done, but the chemoradiation effect was on the buccal mucosa and the patient is cured now. There was a fistulous opening of the CA cheek. So coming together is just beginning. My dear friends, we have come together, it's just beginning, and I will try to have this to make it to keep this togetherness, to make our progress, and when we start our journey, definitely we will success to up to some extent. So my dear friend, the quality life in a terminally patient, because the patient is having social relationship is one problem, emotional well-being is required, quality of environment is in the family and society, work culture, health and financial material is well-being, and belongings care is very much, and overall and the personal safety patient wants, and that can be achieved by the quality care, quality life, and that is mentioned here and there in the text of Ayurveda, that can be utilized. So one home carry message is a wise physician said, the best medicine for a human is care and love. Someone had asked that if it is not working, then he smiled that increase the dose. When you find that the yesterday's visit was not sufficient and the formulation was not effective, then increase the dose with the love and affection. Definitely your patient will improve the quality life. So we are just instrument in the hands of God. God is there. Destiny is always decided. But what the better we can do, that must be our knowledge, our approach, our discussions, and our team. The palliative care work depends on these factors and multi-system approach, multiple track approach, and with the safety of the patient is very much essential. Otherwise, God is there, He is helping us, and we have to make a keen object that we have to pass goal, that we have to help the suffering, we have to cure the suffering, we have to help the nation, we have to a vision to develop our nation. With these words, I express my thanks with this pray that Sarve Bhavantu Sukhina, Sarve Santu Niramaya. My dear friends, the topic is new, but I think I was able to convey my message up to some extent to help the real needy persons with the principles of Ayush with the principles of Ayurveda. Thank you. Thank you, organizers, especially Dr. Pawan Sharma ji, and many congratulations to having that much awards of the this organizing this international conferences. Thank you all. Thank you. A very good evening to all of you.
Pandey, thank you so much for this comprehensive presentation. We are very fortunate to have you in person also with us, although there was a recording that we had. Apologies to all viewers for the slight technical issues that we had, but we will try and resolve this. Pandey is here with us. We want to move the program along. I know we are very, very lucky to have with us visitors from London. Naveen ji is there. Dr. Cecil Colasso, who is a senior rheumatologist and a fellow of the Royal College of Physicians. He's here with us today. Rampalji Somaniji is joining us from Rajasthan. And we also had Sudhir Bagaji. I don't know if he's still here with us, but very senior physicians here, Kuldeep ji. So I think they will all have questions for you as we progress, as we come to the end of the program. Pavanji, are we proceeding to the next speaker, or are we taking some comments or something to?
Yes, sir. We are proceeding for next and last speaker.
Thank you, Pavanji.
So, Dr. Anjali, thank you. Thank you, Dr. Pandey.
Thank you so much.
Excellent. Really, beyond expectations. Beyond expectations.
One or two comments, Pavanji, if I may make on Pandey, as it's fresh in my mind. Pandey, one comment that you made is palliative care does not, a carer does not have to be a doctor, you know, and it kind of completes a circle in the last comment that you made, which is love and affection. If it doesn't work, increase the dose. So what we are talking about is some aspects of health and care that is beyond medicines. Yeah. And it came through very clearly in your presentation. That the second thing that I just want to highlight here, because we will come into the discussion section, is that Ayurvedic concept of ojas. You know, and you touched on this ojas aspect, and you said, and ojas, as soon as we open the package of ojas, we have to start explaining to people what is prana, what is nadis, what is bala, what is chakras, and it becomes a bit messy for a lot of people. But you are saying that ojas and nutrition, there is a dialogue there, there is something that we can do. We won't go into this right now, but please let us listen to the next speaker, and then maybe senior colleagues like Dr. Cecil Colasso, we know Cecil as Bernie, he might have some questions for you. Cecil, Dr. Bernie is joining us. He's a senior rheumatologist, so he understands this issue about pain. He has been treating patients in London at the Central Middlesex Hospital, which is the teaching hospital for Imperial College. And he has been getting extremely good response for pain relief, for psychological issues in rheumatology using yoga therapy. So it is unusual, yes. So maybe Cecil, Dr. Colasso will have some questions for you as in the question answer session. Thank you, sir. For I hope you will stay with us. There is one other question that came through from our from several questions that have come out, which is the term that you have used for the name of your department, Sangyaharan. How can we explain that term? We will come to this towards the very end of this discussion. Thank you, Ji. Pavanji will take us on to our next speaker. Namaskar, Pavanji.
Thank you, sir. Thank you very much. Now I would like to request Dr. Anjali Rajeevan, Chief Physician of Holistic Arogya, Kuala Lumpur, Malaysia. Welcome, Doctor. Welcome. Stage is yours.
Anjali ji, namaskar. Thank you for joining us from Malaysia. I hope you can hear us.
Yes, I have sent the video. Should we play that or?
Anjali ji, before we come to the video, maybe either now or later, but ideally now, just a few words about yourself and how you came into palliative care, where you did your studies and how you came into palliative.
Sure. I'm actually from Kerala, Cochin, and I've studied my BAMS in AVP, Coimbatore Ayurveda College, and I passed out in 2012. And I came to Malaysia around 2014-15, and I started my practice here. Here with Dr. Sibi, he kind of a director with a Cancer Vibe Society here. So I used to work with him, providing talks and other suggestions and everything. Currently I'm the chief physician of Holistic Arogya, that is in Kuala Lumpur. It's an Ayurvedic center. It's not an IP hospital. It's more like a clinic. And I've been giving talks and presentations and to create more awareness about Ayurveda in Malaysia. It is one of the countries where Ayurveda is really recognized. And there are a lot of Malaysians from here, local Malaysians who are on scholarship and studying in India. So we are trying our best to create more awareness about Ayurveda. And the government is also kind of a little bit supportive here. So I think the Ayush, the people who are working together with the Ayush might already know that there are certain centers funded by the Ayush government as well as the Malaysian government working towards, creating more of awareness and being reachable, the Ayurveda being reachable to everyone here in Malaysia.
Thank
so
you.
that's about me. So here I'm talking about the role of diet in palliative care. And I wish to give my thanks for all the people behind the organizing this. And really, thanks a lot, everyone.
Thank you. You mentioned the name Sibi. We will come to that a little later after your talk.
Thank you.
Thank you, Anjali. Thank you for being with us to take questions after the talk. Thank you.
Hello, good evening everyone. I am here to speak about how Ayurveda can help in palliative care as well as in terminal illness with special regards to diet. Let us start by the definition of palliative care. WHO defines palliative care as the prevention and relief of suffering of adult and pediatric patients and their families facing the problems associated with life-threatening illness. Palliative care aims at improving the quality of the life of the patient and also to lessen
Pavanji, we've lost audio.
The very purpose of Ayurveda is of preserving the health and treating the disease. Let me read out a definition given by Charaka, Acharya Charaka, in one of the oldest textbooks in Ayurveda called Charaka Samhita. So he says, the pure as well as waste products of digestion as well as metabolism enters into various channels of circulation and circulate through them. These channels carrying specific nutrient material that provide nourishment in required quantity to various tissues. Thus, the body is the result of nourishment drawn from eating, drinking, licking, and masticating. Diseases are also manifested in the body by the food taken in these four manners. Intake of wholesome and unwholesome food is responsible for the maintenance of health and production of disease, respectively. Another definition of health given in Ayurveda Samhitas is as a balanced state of all the physical elements such as dosha, dhatu, mala, agni. We will explain in detail about the dosha, dhatu, mala in the following slides. So the definition goes by a balanced state of all these physical elements along with congenial mind, senses and soul. Due to its holistic and individualistic approach, Ayurveda can be a beacon of hope in palliative care in India and globally. In this presentation, we will review concepts and modalities of Ayurveda with special regard to diet, which can prove to be very effective in improving the quality of life of people in palliative care. Let's talk a little bit about the basics of Ayurveda before going further. This will help you to understand the concepts better. Ayurveda is based on Vedic philosophy, and as per the Vedic philosophy, everything in the universe is made up of 5 elements, otherwise known as Panchamahabhutas. Our human body is also made up of these 5 elements. When it comes to physiological function, we classify Panchamahabhutas into 3 doshas known as Vata, Pitta, and Kapha. These doshas are responsible. Concept of Ama. This is a very unique concept of Ayurveda. In the previous slide, we spoke about Agni or the digestive fire. In fact, the strength of Agni in the body is amongst the most crucial factors in determining your overall health. By contrast, Ama is a toxic, disease causing substance that forms as a result of impaired Agni or your digestive fire and in turn destroys the Agni. Simply put, Ama is a
Mm. Pavanji, we keep losing the sound. Is this?
These are the other 2 important points that need to be noted when we speak about the quality of food. Karana otherwise means processing of food. Processing of food includes a lot of things. How you prepare food, what utensils you are using, what kind of ingredients you are using in the cooking, and how you are storing it. All this makes a very important role in the whole quality of food. So Ayurveda says certain foods shouldn't be combined. We call it viruddhahara, combining 2 or more substances together, and if those combinations are being prohibited or contraindicated, that leads to the production of ama, which in turn leads to many diseases or worsening of an existing condition. For example, honey and ghee in equal quantities is considered to be a incompatible combination. Non-veg with milk or milk products like yogurt is considered to be a incompatible combination. Taking these products, especially by a person who is ill or who's been bedridden or having a major serious issues, can only make his condition or her condition worse. So make sure that when we cook food, we try to avoid as much as possible the viruddhahara or incompatible food combination, and make sure that you cook the food with fresh ingredients as well as in a proper vessel, and make sure that it is clean and store it in a proper vessel as well.
No recording is observed. You can continue. I can show the slides.
Pavanji, we have lost the audio signal again.
Sir, audio is recorded on each and every slide separately.
Separately, okay. Who is controlling the audio, Pavanji?
I am
Oh,
unable to find video on these slides.
okay, okay. Maybe we move to the next one. Yeah.
Can I just explain this?
Please.
Yes.
Yeah, next one is basically the quantity of food. So everyone, when we speak about how much one person should eat, all of us are lost. So as per Ayurveda, we generally recommend to eat the food half of your stomach with the solid food and 1/4 with liquids, and another quarter should be kept vacant for the free movement of vata. If you eat full, that leads to indigestion. So generally in Ayurveda, we don't recommend to eat full stomach. We recommend to eat half stomach, and there should be enough water or liquid in the food we eat. So according to Ayurveda, when you eat proper quantity of food, this is what you feel. Freedom from the distress in your stomach, absence of any cardiac discomfort, the non-distension of sides. Generally, when you eat a lot, you will have difficulty in walking or difficulty in doing work. So when you eat up to enough quantity, you will not feel any of those things. Freedom from excessive heaviness of the stomach, gratification of senses, subsidence of hunger and thirst, sense of ease in standing, sitting, lying down, walking, inhaling or exhaling, easeful digestion and assimilation of food in evening as well as in the morning, and imparting of strength, complexion, and plumpiness. This is the description that has been written in our Shastras many thousands of years back. So when it comes to palliative care, we know many people find it difficult to eat a lot of food, especially those who are bedridden and all. So we recommend them to eat light and easily digestible food, more like porridges or soups, especially with moong dal soup, rice and moong dal soup, khichadis and all, which are easily chewable, and it has enough nutrition in it to kind of help them to have basic strength and stamina. Let's go to the next slide. When it comes to kala or time, these are the recommendations that we generally recommend: the breakfast, lunch, and dinner timing. But as per Ayurveda, one should eat food only when you feel hungry. That is why it's been written eating before the previous food has been digested. Eating too much or too little at the wrong time can also cause problems. Especially people sometimes tend to skip meals. And those who are in palliative care, they mostly say they are not hungry, or they sometimes forget, and they are too stubborn sometimes to eat food. So what we recommend is to eat light, even if they are not hungry, even if they are saying not hungry and do not need food. Make sure that they eat very light and easily digestible food at proper timings. And for a healthier person who are not bedridden or who are not at the terminal illness condition, it is better to wait until they get hunger, so that the food they eat will get digested properly. Fasting is another point that I want to note here. Fasting is beneficial, especially to clear ama, to improve the metabolism and all. But it has to be under the guidance of a proper Vaidya or a proper doctor, because fasting for long hours can also impact the health in an improper way. Second point to be noted in Ayurveda when we speak about time is the seasons. We have 6 seasons in Ayurveda. And you can see, especially in the winter, late winter and early winter, generally our digestive capacity or digestive ability will be high. So you are allowed to eat heavy foods like milk or grains, especially newly harvested grain, which are considered to be heavier, and which is not advisable during the other time or other seasons. And also meat or heavy food in general. But when it comes to autumn or spring, can we go to the earlier slide? Earlier slide. Earlier slide, sir. You are clicking on the next one. One more. Yeah, when it comes to spring and autumn, you can see our digestive capacity will be moderate. So again, the digestion should be of the food that we select during this time period should be always of moderate heaviness, or easily digestible food like barley, wheat, honey, or all sweet, light, cold, bitter food and drinks, because this doesn't require too much of digestive ability, or it is easily digestible, so it doesn't cause any congestion or any ama production in the body. When it comes to Grishma and Varsha, that is the summer and monsoon season, our digestive fire will be at the minimum. So we generally recommend easily digestible food, and especially in the summer, more cooling foods, and during monsoon, a bit hot and warm food, because it helps to clear your digestion, it helps to have good metabolism, and it impart more strength during that particular seasons. Let's go to next slide. Ubayukta. This is not this is considered to be one of the last, but the main thing, some of the points that we are discussing here, like Ushna, Snigdha, and all, we already said in the previous slides. Generally in Ayurveda, we recommend to eat food which are hot, which are Snigdha, unctuous in nature, and which is freshly prepared. And also, it should be of proper quantity. And we also mentioned eat only after the digestion of the previous meal. That means when you feel hungry. Eat those foods which are not antagonistic in its potency. That means viruddhahara or incompatible food combination should be avoided at always or at any cost. Eat in a congenial place. This is something that we are forgetting nowadays as a community. All of us has the habit of like watching TV and eating, going through your messages, WhatsApp or Facebook, or even reading newspaper or books and eating. All these things which take away the attention from the act of eating is considered very normal nowadays. However, I can assure you that is not the normal way of eating. Eating or food is something that gives you prana or life. So we have to eat it with a gratitude. We have to give that importance to the act of eating. So always make sure that you sit in a proper place and eat with a gratitude. Just take a moment, like maybe like few seconds, 30 seconds, or even a minute. Just sit in front of the food and close your eyes. So what does it do? Basically, every religion around the world, you can see we have the habit of praying before eating. The science behind is when you close your eyes and when you sit in front of the food, you are actually preparing your body for the digestion. Your mind knows that you are going to eat. That increases the secretion of saliva and acid secretions inside your stomach and prepare your body to digest the food. So make sure that you eat in a congenial place provided with all the necessary accessories, means good and clean plate or spoon, whatever accessories are needed, it should be there. And the main important thing is not to eat too fast or too slow. Because when we watch TV or when we speak to someone or when we are reading, we always tend to either eat fast or eat too slow. So this is to be noted especially. Why? Because just making these small changes in your day-to-day life can actually impact your digestion and your health in a tremendous way, especially those who are having constipation, gas, bloating, indigestion and all. Make sure that always when you eat in a proper place, sit down and give attention to the act of eating, which is very, very important. Taken without talking to others, taken without laughing, or taken with the concentration of the mind. Give concentration to the act of eating, because that's how we are getting our life energy. We are not yogis, we are not rishis, we are not getting it from the air. So we have to eat food for our survival. So respect that particular act of eating. You can see here, like nowadays we can come across all these people who are walking, eating, driving and eating. But how many of us like sit down with the family or sit down with your friends, like eat in a calm place? This is what we need in today's world. So even if people in the palliative care, make sure that they get that attention, give them a proper place and make them happy. Otherwise eating alone in the room without anyone, so they feel more depressed during these times. Another important topic is Ubayokta, means a person consuming food. That is the person who is having or eating the food, how one should select that particular food for their constitution or their imbalances. That is what Ayurveda says about. For this, you need to have a personal consultation with an Ayurvedic doctor or Vaidya, because every individual in Ayurveda is unique. So we cannot generalize anything. We can only determine their particular imbalances by proper consultation. So after that consultation, we can recommend them what is good for them and what is bad for them at that particular state of their health. So make sure when you chart a diet for a particular person in palliative care, make sure that they consult their Vaidya and accordingly chart what is good and bad for them. This is something that I cannot miss while we speak about diet in Ayurveda. Generally, we have 6 tastes in Ayurveda. All of you know the sweet, sour, salty, pungent, bitter, and astringent. and you can see the examples of each particular taste. Everyone knows about sweet, sour, salty, pungent is. Some people have a bit of confusion with what is bitter and what is astringent. So that is why I gave the examples here. All the legumes, pulses, green banana, capsicum, bell pepper, all these things come under the taste of astringent. So first three taste, that is sweet, sour and salty, increases kapha in your body and decreases vata, whereas pungent, bitter and astringent taste increases vata and decreases kapha. Sour, salty and pungent taste increases pitta. So you have to check which particular dosha is in imbalance, and we have to select the food as per the current condition. Foods that are contraindicated for daily use. One should not take heavy foods such as dried meat, dry vegetable, lotus rhizomes, and lotus stalk. One should never take a meat of diseased animal. Moreover, one should not take regularly boiled buttermilk, spoiled milk, pork, beef, meat of buffalo, fish, curd and yogurt, urad dal, and barley. I think the most surprising among all these things will be the curd and yogurt. And I can see in most of the places, even for a healthy person, a lot of people push, especially the modern nutritionists, push the curd and yogurt saying it is probiotic. But I have seen in a lot of people this giving them a lot of trouble, especially those who have rheumatic complaints, or those who have autoimmune degenerative condition. Taking curd on a daily basis will interfere with their healing, and that can increase the inflammation in the body. Same with the urad dal. Most of the other things, it is well known, like most of the people know that taking meat or fish and all during an inflammatory status might make it worse. But fish and the yogurt or curd is something that people doesn't know, and I want to give that focus here. And it is written in Charaka Samhita many thousands of years back, and it is still we can see it in our patients how taking curd and yogurt on a daily basis can interfere with their metabolism and inflammatory status in the body. Can we go to next slide? Food that are indicated for daily use. So these are the foods which everyone can take regardless of whether they are healthy or unhealthy. Navara rice, which is a variety of red rice which generally cultivated or widely available in Kerala. Mudga or green gram, rock salt, Indian gooseberry, rainwater, ghee, meat of animals living in arid climate, and honey. So these things anyone, so those who even are undergoing palliative care or terminal illness, these are the things I generally recommend for a day-to-day use. Making a mudga with red rice soup, or even porridge, or even khichdi with a bit of rock salt and all can be highly nutritious for them, and it imparts them a lot of strength and stamina. At least those days can be of good health. They don't get bloated, they don't get constipated while taking these foods, and it is recommended for a daily use even for the terminally ill patients. So to summarize my presentation, I would like to say to everyone that eat food with high prana, especially the people who are under palliative care, because this has a very positive effect on the body. Eat organic, locally grown vegetables and fruits whenever possible. Please pay for the extra amount, because that is very, very, very much essential for the health of the body. Taking pesticides laden fruits and vegetables can have a very drastic effect on the health. So make sure that whatever you eat is organic, and make sure that it is seasonal and locally harvested. Cook with energizing spices. Using a moderate amount of spices in food will give more acne to the body, or it impart more acne, and it helps in the overall digestion of that particular food. Avoid genetically modified food, frozen or preservatives or preserved foods as much as possible, and also avoid incompatible food combination, processed, preserved, junk food. Always drink boiled and warm water. Why? Because boiled warm water can have a good effect on your ama, as well as good effect on your metabolism. It can increase your acne in your stomach as well as in your cellular level. So it kind of increases the circulation, reduces the inflammation, and helps to help with the digestion as well as elimination of the waste from the body. So make sure you always drink warm as well as boiled water. Minimize as much as possible eating from restaurants and try to always eat in a settled atmosphere. Eat only when you are hungry. The most important point of first sign of becoming healthy is to get hunger at proper times and to eat only when you are hungry. All these things whatever I mentioned here are general principles. It is always important, and I specify it again and again, to kind of to consult a doctor to diagnose and chart the diet according to that person's body status. Every individual is unique, so it is very much important that they have to consult a doctor for charting Ayurvedic diet as per their current status of health and disease. With this, I am summarizing my presentation, and I would like to thank all the doctors who are behind it, all the organizers and moderators to give this opportunity. I'm sorry for the small trouble with the voice and some, difficulties with the presentation. Hope I'm able to explain everything in detail. Thank you. Thank you all.
Thank you very much, Anjali. Thank you so much. Apologies to all for the slight technical issues. Anjali, what we will have to do to solve this is to have you back for another talk. And Pavanji will identify a date and a theme where you will be able to come back and share a lot of the information that you have shared with us today.
Thank you.
So, Anjali, you also touched a very important point about prana, which came up earlier on, and your concluding slide had eat foods high in prana and sattva. And these are all the issues, or these are very important issues, because the Vedic system accepts these things, but a lot of people who are not aware of the rationale will find it difficult to understand.
Yes,
now,
true.
Thank you for highlighting this, and also the point about boiled and warm water. Again, these are very, very important aspects, because contemporary molecular biology, cell biology, and signaling systems connects the heat receptors. So we have special receptors in our body which senses heat, and they're connected with the healthy working of the immune system and many other aspects of the human body. The heat receptors are also the receptors for the katu rasa. So there is a logic there, but when we go through it very quickly and we use the Ayurvedic terms, not many people see the connection.
Understands it.
So thank you for highlighting all these things. Renu, I'm going to start off with one or two questions in the chat box. Anjali, you might have seen that. Pavanji, you want to make a comment?
Yes, our third speaker has joined Dr. Anita.
Oh, okay. So we have a third speaker.
Also
so let
from
us.
Malaysia.
Okay. Thank you,
I
Pavanji.
welcome Dr. Anita. Please unmute yourself.
We will come back to these questions, Anjali. If you look through, Renuji has asked one question.
I will answer here. I think it's regarding Murfest, which I am aware. I will answer in the chat. It's fine. We can go ahead with the next speaker.
Thank you, Pavanji. Anjali ji, namaskar. Oh, sorry, Anita ji, namaskar.
Anita ji.
Namaskar, sir. Namaskar, sir.
Namaskar.
Sorry, sir. I'm still traveling, so I'm a little not visible fully now.
Do you want to have a little more time to join us from where you are? When you come?
Yes, maybe another 10-15 minutes.
Wonderful. We can join. We can join us in 10 or 15 minutes. That'll be the best, because we would love to see your face too.
Thank you so much.
This is the speed at which the communication technology is helping us interact with the world. I want to give the floor initially, Anjali, and so first of all, thanks to the two speakers. Anita ji will join us from Malaysia a little later in the program. But I want to thank our two speakers, Pandey ji and Anita ji.
800 meters.
Hello.
Turn right.
Okay, we'll mute Anita. Sorry. So I want to a question that is always asked by contemporary physicians and people from contemporary medicine is, how do you validate what are all the things that you are talking about in the Vedas, etc., etc. Pandey too. The question that is asked is, how can you convey these things with experimental measures or something? It's generally said that we have used this for thousands of years, but people who are not familiar with these systems will raise this question. And I want to give the floor to Dr. Cecil Colasso, who's joining us from London. We know Cecil as Bernie. Cecil is a consultant rheumatologist connected with the Central Middlesex Hospital, which is one of the big teaching hospitals for Imperial College for Science, Technology and Medicine. And I leave the floor to Bernie. Bernie, thank you so much for joining us today from London.
Well,
you can see.
Thank you. Can you hear me?
We can hear you clearly. The floor is yours, please.
Sure.
We want some comments about what you've heard today. I know
the comment that you made is relevant to my learning and experience of all matters Ayurvedic, and I suppose you're using my Western medicine provocative language. The charm of traditionally trained Ayurvedic physicians who clearly have devoted clients, and that's the outcome, is devoted clients. It's the same for Western medicine or for Ayurveda. But the complete belief and the reference, which is wonderful for me, we have Western medicine, which have got 300, 400, 500 years of real scientific basis and, maybe 2000 years of imagined science. But when you make reference back to 3,000, 4,000 years of traditional instruction, that's really very powerful. What I am not sure is, in your tradition of teaching and learning, where the space is for development. And for instance, in the last 50 to 100 years, there's clearly been a willingness to merge and to openly compete for your, obvious outcomes, and to compete for the space on the ground with Western medicine, which are, rushing ahead with ridiculous technological change. And we keep putting in the big stick and the carrot of saying, look, we've got all the evidence, we've got the numbers, and we've done the science, we've done the maths. And then your whole tradition comes along and says, yes, but we follow the tradition. What I haven't seen is, and I'm sure it's out there, because I know there's lots of publications, the outcomes are fine. But it's, what is your system of development of practice and development of using even the nutritional herbal remedies, which are always cited as safe. And I always have a concern from a simple approach to biology that if something is going to be biologically active, and as I think you've even mentioned, the last speaker said, you take good foods in the wrong quantities, they're actually negative. So we've got to allow that good nutritional or effective remedies, if misused in non-trained hands on inexperienced, the young Vaidya, it can maybe inexperienced. In inexperienced hands, is it ever considered that amongst your own community of specialists, do you ever look over the shoulder of another practitioner and say, well, look, he doesn't really know what he's doing? So where do we get the concept of quality of practice, which is one thing, devotion and following teachings, I can understand, and then development. So it's an assessment of quality of practitioners and a question on where is Ayurveda going? Where's the development? You with me?
Thank you. I think you've touched on two very important points: assessment of quality of practice, and if I can phrase it, benchmarking of practice. Yes, somewhere in there. And where does Ayurveda want to go? I don't know, Bernie. Before I give the floor to either Anjali or Dr. Pandey to address this question, I would like you just very briefly to tell the audience here about your experience with yoga. You are a senior rheumatologist. You have 4 decades or more of practice looking at rheumatological issues.
Sure. No, you're welcome to that. But very briefly, I mean, this is my introduction,
please,
perhaps in hands-on to traditional Indian medicines and practice of Ayurveda, which includes yoga. And I was approached by a trainee yoga therapist towards the end of her diploma, and she needed access to patients. And I said, fine, we have a patient group, you're very welcome. But, I was fairly dismissive. She treated 4 patients and 3 were sort of hanging off thereafter. They were delighted. And so I woke up a bit, and then she said, well, how about treating your patients? I said, well, you just can't bring in that complementary medicine into an NHS clinic, and it doesn't work that way. We can't establish it. But if you want to do some research, we'll try it. It's very difficult to get funding for research. We've got a small amount of money. Did a small study of 10 rheumatoid patients. And of course, these were my patients, my clients. I'd known them for years, but I didn't select them. In fact, one of the first 10 that went through this little study, I almost deselected and then said, no, look, I'm fooling around with recruitment. Let her go in. Let her be a scud missile. She's going to abreact to this tradition, and she may be insulting, but, because she's very, very strong personality. She may be insulting, but we can still describe that as the fallout. That's reality. This is my clinic. So I absolutely did not select patients. I just held back from being selected. And of those 10, and I now still call them the Magnificent 10, every single one of them responded to 10 individual 1-hour sessions of yoga therapy. So it was quite intensive and quite expensive, but through a grant, it was free for them. Yes, they were happy to get something free, and that's about all you could say was a confounding variable.
Were you surprised by the outcome?
Sorry? Yeah, but in front of my eyes, they all recorded improvement. The improvement on anxiety and depression was evidenced on standardized protocols. And then what I experienced over the next year or two was that they continued with their practices. They continued to do well. They continued to want to come off their drugs. They would then hit crises and hit, further relapses, as any rheumatoid might do. But they were still better off as that group of 10 and cheaper to manage in terms of drugs and whatever, and safer than they had been before. So my personal detailed sort of intervention with just these 10, with all my own personal biases, I know that I set off not expecting any change. So I can be my own arbiter in this case as to why I'm converted to the cause, but I don't maintain that it has to be yoga therapy. My approach would be that this is an impact of yoga therapy on what is very clearly a mind-body physiological response. So we call it biofeedback, call it whatever we like. There has been physical change, there's been metabolic change, and now I have an interest through the leadership of my mentor, Madanji, and I'm interested to understand the balance and which again, from a critical, uninitiated and a distant observer, all of what one sees in Ayurvedic presentations is always just anecdotal, experiential, and subjective.
Benny, I'm requesting for you to turn your video on so that
I'm sitting in a mess of papers. I don't want to. I
Okay.
don't want to
You don't want to be seen.
to reduce the impact of my discussion.
Thank you, Benny. Thank you so much for joining us today
operator.
from London. Thank you for sharing. Thank you for asking the question about assessment of quality of practice and benchmarking of practice, etc. And thank you also for sharing your experience of yoga and responses in rheumatoid arthritis and pain management. So you are a very senior physician. You're a fellow of the Royal College of Physicians, a 500-year-old institution or more. And you are now saying that hesitantly you accepted to test yoga and you were surprised to see the positive impact. So I'm going to hold it there and invite Dr. Professor Pandey from Banaras Hindu University. Namaskar ji. Pandey ji, you are now talking to London. You have heard from London. Bernie ji is sitting in a place in London named Ealing, which is in the western part of London, northwest of London. And Bernie ji studied medicine at the University of Bristol. And over the last 45 years, he has climbed up the National Health Service ladder, and he's one of the senior rheumatologists in the country. And 70 plus, sorry, Bernie, I have to disclose that. And here is Pandey ji, senior physician and creator of this department. Pandey ji, please tell us firstly how that name that you have for your small unit in the Faculty of Ayurveda and BHU, the name. And secondly, in your slides, you had highlighted yoga as one of the non-pharmacological interventions for palliative care, which is being supported by Dr. Bernie in London. The floor is yours. I think this is an opportunity to establish an even deeper interaction between Banaras Hindu University and London. So,
thank you, sir. First, what the name of Sangya Haran is striking to all of you. Actually, Sangya Haran is the word made up of two words, Sangya and Haran. Sangya means the sense of perception, and Haran to keep away. When a patient is being anesthetized by any drug or technique for a purposeful act, and that can be reversed either by the self-metabolism or by the antidotes using to make again reconscious a patient. In modern medicine, the Hindi terminology of anesthesiology is Nisangya, but grammatically it is not quite. And Sangya Haran is it is not a noun. It is an adverb along with the adjective.
Adverb.
So grammatically, according to Shabd Kalpadruma, the Hindi dictionary of Hindi Sanskrit dictionary, it is clearly very much clear concept that Sangya means the department who provides a technique or the services to make a patient pain-free during any surgical procedure, and that can be reversed. This was the vision of Mahamana, because we all know Sushrut is the father of surgery. He learned surgery from Adi Devadas Dhanvantari at Kashi, that is the Varanasi. And then other contemporary fellows were Aurabha Paus Kalawat, Gopurakshit, and so on. But only thesis of Sushrut Samhita is available. What were the others is not available. And that's why the Department of Surgery was established by Professor P.G. Pandey, who established the Chasutra therapy worldwide known. And then there was a need to cater the anesthesia services to the Ayurvedic persons. Then we too started this department by the blessings of our Guruji, Professor S.B. Pandey, and with his Guru, Professor K. Pandey, and blessings of Professor Basu, and then he was the professor in Texas, they asked us that if you want to really develop your anesthesia in Ayurvedic system, you have to take the help of chemistry, physics, and Ayurvedic principles. Then we started this department as independent in 1993 when I joined this very institution as a faculty. And ultimately, because of our services, the independent department ever in the history of Ayurvedic institution was established in 2011 by the signature of the president of our country. This is about the department.
Thank you, sir.
Now, right now we are running in the department anesthesia services, pain management through Agni Karma, Jalauka, and non-invasive therapies, and the palliative care with the help of other faculties. This is about what department and Sangya.
Is the term Sangya, before I let you move on, is the term Sangyaharan, does it appear in one of the Samhitas, in any of the Samhitas?
No.
It doesn't appear.
Sir, I want to clear here. In many times people ask, where Sangyahara is mentioned in the Ashtanga Ayurveda. In Ashtanga Ayurveda, only 8 clinical subjects are mentioned. Kaya, Bala, Grahordvanga, Salya, Dharansta, Jara Vishay. Can you tell me, anyone can tell, where is the Sharir Rachana, Sharir Kriya, Dravya Guna, Rasastra, Nidan, Prasuti Vigyan? It is not mentioned, but they are essential. They are the backbone of system. Then how we can think about, Sushrut has performed many types of surgical procedures, orthopedics, plastic surgery, craniotomy, and rhinoplasty. Was it possible without anesthesia? No, not. There might be any problem, or might be any chance that either that text was stolen by the attackers, Mughals and English people, or they were destroyed, or they were limited to the family members, because there was a problem in the kingdoms. If anyone knows the techniques or drugs to anesthetize any person, and that may cause a problem, a social problem, that might be one of the reasons. And second one is the surgery department was established, but no one ever thought that what the technique of the surgical procedure to make a pain-free surgical procedure was adopted earlier. No one thought. And that is the problem. And now the question has raised to us, and we have to solve the problem, and we are trying our level best.
Thank you, sir. Thank you for clarifying so many points. Now to the question about the role of yoga for pain relief, which Dr. Colasso has seen in London. He didn't believe it first, that in rheumatology patients with complications, with a young yoga therapist from New Delhi who came to Dr. Bernie's clinic. He could see the results in front of him, 10 patients, and he says he saw this. Now, this is difficult for a physician in London to believe. And the question is, what are you doing to standardize your protocols? What are you doing to validate these protocols? Is there a way to do objective assessment of pain? Is this something that is going on there? Do you recognize the need for it?
If I just come in there, Madan, just to help with this discussion, we furthered the study to look at another 10 patients with psoriatic arthritis, which I know from my persona and experience is a completely different myriad of conditions. And I was expecting it to be more difficult to recruit and to manage, and it was slower to recruit. And the management group, the results immediately were variable. It struck the yoga therapist immediately. She said, "What's wrong with these psoriatic patients? They're completely, each one was individual and complex." Either way, she went through the process of it. We still got good results on pain and anxiety and depression, but it wasn't as striking as my magnificent 10. Now, that could just be sample error, because these are two very small studies. But the impact of the psoriatics, quite interestingly, she went back to it 2-3 years later, and we knew that the rheumatoid patients were still trusting what they had learned. So this has had a much more prolonged impact than any physiotherapy or other sort of accepted Western complementary care. So the rheumatoids were very happy to continue their yoga, and they knew when they fell off the wagon that things might get worse, and or when things got worse, they would up their yoga activity, and they were sort of self-caring. They got the message. The psoriatic group were a little bit more variable, but she's just done a qualitative study, and the simple sort of information from a small number was that the psoriatic group were individually and as a group asking for group therapy follow-up. And this is interesting. If it's different, it might mean that the mind-body psychoneural inflammatory pathways for each condition is different. And of course, we could say, well, that's obvious, but here is an outcome difference where one group of patients with certain tissue damage is requesting a different pathway, a different level of mind-body support or intervention for their self-care package. And I wonder if you get that experience across the range of conditions or different reasons for people being in palliative care, that you get responders and non-responders, or people who respond to, you know, that individualization. Is it able, are you getting clusters of patients that are teaching you something?
Thank you, Bernie. I think you're coming into some very, very exciting observations. I think Pandeyji might be the senior most person here to address that question about differences and how you can modify treatments, etc.
Thanks to Dr. Cecil. I'm very much pleased to interact with him. A word in Charak Samhita Sharirasthana is mentioned, Yoge Mokshe Sarvasam Vedana Nam Vartanam. Yoge Moksha Pravartaka Mokshe Nivritti Nishesha. This is a version. And how it helps. I will.
Sir,
like
could you translate this for Bernie, please?
All sort of sorrows be pacified by the application of yoga, and then the moksha means divines. And yoga instructs a person to be isolated from the other sort of feelings of sorrows, and that is the process of moksha. But when we start feeling the pain, he has again mentioned Vedananam adhisthanam mano dehasya sendriya kes loma nakhagranam maladro gudairvina. The seat of pain is mind and body, and the fluids and the nails and the hairs. There is no feeling of pain. But sendriya means the cell which is alive, having the metabolic function. Any stimulus or obnoxious stimuli may alter the behavior of the cell, then we start feeling pain or unpleasantness. That is the version of Charak Samhita. Now, how it is going to be helpful for the patients of palliative care? What is the basic difference in yoga and physiotherapy? Again, the question arises. In physiotherapy, we learn exercises to a patient according to the movements of that particular joint, which is restricted. Then a patient feels pain because that movement restricts the joint natural movements, and the patient feels pain because of the stretching of muscles, ligaments, and tendons. But in yoga, what happens? We provide certain exercises, even a patient who is not able to perform some exercises, but the basic exercise is the pranayama. And pranayama is of very many types, and adopting those types according to need of the patient, you can perform. I have registered 4 students of yoga, health sciences, and they are working on this very topic, that how yogic exercises are going to be fruitful for the patients of terminally ill. And for that, we have designed some certain biochemical investigation for pain, serotonin, endorphin, serotonin, and 5-HTs, and then EEG, IMG, catecholamines. On those parameters, we are trying to analyze up to which extent that particular exercise is going to help the patient to pacify the pains. This is one. And not only this one, these yogic exercises, they stimulate the natural form of the endocrinal secretions, and they play a great role for the neurohumoral or neurohormonal function of a person. So in a terminally ill patient, using certain analgesics, they will definitely lead, either they are limitations or they are having some sort of untoward effects, and that can be curtailed. On one hand, we are curtailing the obnoxious problems, creating the factors such as the medicines. On other hand, we are using non-pharmacological approach to build or to enrich the cells in a natural metabolic state. This is the basic difference between yoga and how yoga is going to be helpful for a terminally ill patient. And we are getting good results, sir.
Sure. No, I'm absolutely sure. If the But one concept that I sort of am currently believing in, but I'm looking to prove that it's, does that have holes in it? As a student from a distance, learning how yoga is applied, let's say, to my patients the same way that I could apply a balm or a pharmacological agent or a referral to physiotherapy. What I've experienced in my patients' responses, a few, I say from now on, at the moment, if we're to look at it further in research, don't start breaking it up. Just let me prescribe the yoga pill. So my Western medicine prescription is a yoga pill, but that means the entirety of yoga as it stands, rather than what is my suspicion, that the most powerful element within the yoga pill might well turn out to be specified pranayama or specific ways of utilizing pranayama in an individual pattern for different conditions. That's my expectation if we get the science to follow the wisdom. But at the moment, for a patient in front of me, I don't want to complicate matters by saying, let me dissect yoga, because then that doesn't give yoga a chance to compete on its own ground. And the element of, as people have raised before in the talks today, of the spiritual aspect, the belief, the trust, the empathy, is all in the doctor-patient relationship, whether it's Western medicine or Ayur. It doesn't matter. So we shouldn't take that away from the yoga therapist and say, look, just give them some stiff advice on pranayama and then leave the room. That interaction is part of the care, and they should be given the same thing. So that's why I say at the moment, if we're studying, we should look at the yoga pill, the whole thing. But that, it brings with it traditional baggage and legacy, and, there are outlandish religious cults who believe that yoga is some creation of the devil. Completely illogical, because it's not even fixed with religion, but people have labeled it. So you have to take that. But that's a small nuisance element, but it's real.
Benny,
I was told off by a Polish Catholic patient bluntly, please don't mention it. This is activity of the devil. I said, well, where do you get your evidence from? She said, oh, it's on all the Catholic websites.
Benny, I'm going to give thank you for, now, number one, I just want to round this bit of the discussion by thanking you for being with us today. Number two, thank you for interacting with Professor Pandey at BHU. And Professor Pandey still has a large number of students who work there with him. And I see an opportunity for yourself interacting with Professor Pandey a little more closely together with his students, and perhaps evolving a small research project where we can take forward some of your systems that you use in London for patient stratification and for some experiments to be completed in Varanasi, in BHU. And I think at least we are starting to see a possibility. Your guidance as a fellow of the Royal College of Physicians here in London and the interaction with Professor Pandey in BHU can bring out immensely valuable outcomes for all of us as a community. So I'm going to bring this.
Have my support. You have my support. I as you know, I've stepped back from the front line of big patient care and stuff. But the concept certainly I will support, and of course Prof. Pandey in Varanasi is very welcome. If I don't see that I have much to offer other than being a willing student. So,
and also more importantly, Bernie, I think you have to be the critic in these studies. I think that's the important thing. You have to raise your comments, your objections, and like what Professor Pandey has just said, he will dig things out of the texts to show you where we have ideas. The things that you're searching for is already there in the old text from thousands of years. I think
but I've handed that responsibility over to you for when you write the article. So I'm not doing that homework for you. Malaji. That's your job.
Thank you. Thank you, Bernie.
Thanks.
I don't know. We have.
I can assure from the organizers that whatsoever you require, I will provide to the organizers directly to you. As and when you feel free, please interact. Most welcome.
You, sir. Thank you, sir. I just want.
It's lovely link and network. Thank you.
Thank you, Bernie, and thank you, Dr. Pandey, for really catching the spirit of Bernie's questions and then pointing us to the richness that is there in the texts and how you are tackling that even today with your students and guiding them with research and experiments. And I feel there is an opportunity to take this 500-year-old establishment, the oldest college of medicine here in the UK, and connecting it with the traditions of Benares, not only the university, but Kashi as such, and the history of surgery and how it all came about, Shushruth, and all these things. I want to draw Pavanji to ask if Dr. Anita is going to present. Anita ji, namaskar. If Anita ji is able to. Anita ji, namaskar.
Namaskar, sir.
Are you now in a safe place?
Yes, I reached.
Are you going to present to us?
I think so. My presentation already I have recorded earlier.
Okay, it might be with Pavanji, who might be listening to us. In case he's not listening, then we will try and wake him up. But thank you, Anita ji. Thank you. Tell us a little bit more about yourself and what brought you into palliative care. Where did you study? What are you doing in Malaysia? What brings you to palliative care? How do you know Dr. Pandey? And just tell us. I think Pavanji is here. There is Pavanji, and he will load up the presentation, and you can.
I have not received, sir, Madam's presentation.
I have sent you through email, sir.
Today?
Yeah, yesterday itself.
Just checking.
Are you, Anita ji, are you able to access your presentation now? Are you on a system where you can access? Then you can email it to me or to Pavanji, and then we can display it again. If it is a large file, then there might be a small difficulty, but otherwise.
Or just share screen and speak to your own slides.
Yes. Anita ji, if you can.
I'm just opening my email.
Okay, thank you.
I think, sir, Pawan sir, already I have put as attention in your name. I think earlier you had seen my mail. I think you must have received it. Can you check again, sir?
While Pavanji is looking for it, Anita ji, please do tell us a little bit about yourself, particularly where you were, where you did your studies and how you connect.
I'm basically from Odisha. So I did my BMS in Odisha, and after that I got opportunity to work with AVP, Ayurveda Pharmacy. So there I have seen you already, sir. So I'm very thankful. And Mr. Sujit, he is my best friend.
Oh, okay.
So he
In
always
Coimbatore.
tells about you. Yes, Coimbatore. And then after that, I had some experience in college. So I was teaching there. I have done my MD, PhD, MD from Karnataka Government College, and then from PhD from Odisha. And after that, since I was there a long time with AVP, AVP has a branch here.
Okay.
So I got the opportunity to work here.
Thank
And
you.
I think we can.
I think Pavanji has located your
yes.
presentation. Okay, we'll come back to you, Anitaji. Thank you so much for being with us today.
I think so. It will be a 20 minutes video.
That's all right. As I know it's very late in Kuala Lumpur, so this is a bit of a punishment for you, but there we are. We are happy to have you with us.
Namaste to one and all present here. It's a great privilege and a pleasure to participate in AYUSH Samriddhi International Conference Series. I'm greatly thankful to Dr. K.K. Pandey sir for giving me this opportunity. In the present scenario, infectious disease pose a substantial challenge to the public health system, but still, burden of non-communicable disease is also escalating. Exacerbating these issues because people have multiple chronic illness, lack of awareness, and insufficient health care, and drastically change lifestyle and the dietary patterns. Among these, cancer, autoimmune disease, allergic diseases, cardiac failure, liver failure, neurodegenerative diseases, metabolic dysfunctions are the major cause of concern. Later, it leads to advanced conditions which is very difficult to cure. These conditions are life-threatening as well as decrease the quality of the patient and their family members, because usually the treatment doesn't respond to the treatment and they end up in the chronic terminal illness. Currently, in India, around 1,000 palliative care centers are available. But compared to the population, only 1% of people, those who get the access for the palliative care. India still need to be more advanced in different states. Now at present, we can think about 2 states which is doing very good. It's Kerala and Maharashtra compared to other states. But I'm still, at the same time, I'm very happy that AYUSH is contributing in a good way for last 3 decades. Palliative care needs a customized holistic care of the people suffering from terminal illness. It aims to improve the quality of the life of the patient and also lessen the suffering of their loved ones. It doesn't replace active treatment, but it is ethically very important for the healthcare professions to alleviate pain, sufferings, whether it's a physical, it's a psychological, irrespective of disease and condition, can be cured. Let's see what Ayurveda thinks about the terminal illness. It happens when the toxins have reached deep into the system. It is not a particular disease, it's a particular condition of an individual. We can call it as any name. It's a Kshaya, either it's a chronic wasting syndrome, or it's a tuberculosis, AIDS, cancer, or an emaciation state. Ayurveda describes them as a malconsumption because it occurs when disease completely runs the individual by consuming the person. Here, malconsumption means here the dhatu portion is not happening and gradually the toxins are loaded everywhere in the system. Example, in a chronic condition where we talk, all the dosas, all the tissues are affected. So malconsumption is a condition where the person is alone. There is no improvement at all in the patient's individual. Let's see why this malconsumption, or we can say dhatu agni kshaya, or why this dhatu paka happens. It happens broadly, we can think in categorize 2 ways. Either it's a out point of view of ahara, or it is a vihara janita. Ahara, when we doesn't follow the classically method mentioned, the Ashtavidha Ayatana, what is mentioned in the classical text, when we don't follow that, like example, when we overeat, adhyasana, over nutrients, irregular time, kala, yoga, matra, and then viruddha annapana, when we do all this, then because of indulgence of improper diet, the toxins are created, undigested toxins are created, which fill the systems. Secondly, when we do excessive indulgence of excessive exercise, excessive sex, or like a fanatic fasting, use of tobacco, alcohol, some of the harmful drugs, we intoxicate ourselves along with our environment. Either it is a chemical, either it is a pesticide, either it is a fume or anything which intoxicate the environment. Because of that, our life forces get exhausted and our structural tissues starts to starve. This slide, we can see how the nutrients, excessive nutrients, improper diet, makes undigested toxins, block the pathways. There is a Srota Sangha happens. After that, it blocks the further movement of the nutrients to the other elements, and then gradually weakens the immune system. When we think about our activities, our environment, here the irregular practices like fanatic fasting, more than higher amount of exercises, use of drugs, also insufficient nutrients on the same time, it decreases the life forces, and then it allows the parasite to come to the body and colonize in the system and weaken the system. Once again, this is the same slide where we were talking about the erratic food habit, erratic lifestyle changes, which makes higher amount of toxins and makes the Srota Shanga, and then becomes a Dhatu Agnikshaya, and then starts Paka in Dhatu. Once Dhatu Paka happens, body weakens, system deteriorates, and then patient invites lot of infection, lot of chronic illnesses. Leading causes, starting from the stress, obesity, diet, drugs, different viruses, age, environment, alcohol, and tobacco. The most common cases what we get in a palliative center is a cancer, heart failure, COPD, kidney disease, Alzheimer's, Parkinson's, and also ALS, such diseases. Based on the level of toxins, the treatment can be managed. If it is toxins are in the digestive tract, easily curable, we can go with some langhana, some aushadhi, we can give medicines to digest the toxins. When it is a gross level, we have to think about doing some of the shodhana chikitsa, which is curable, and also we can do the purification therapy. But when it goes to the very deep level channels or a subtle channels where we cannot separate the toxins easily from the body, then it becomes incurable. We have to think at that moment to do some mild purification or a pacification and basically palliation therapy. This treatment in Ayurveda can be planned in different stages. Like it's the first stage, think about doing langhana, pachana, dipana, drugs. When it is second, third, fourth stage, we have to think about shodhana chikitsa. But when it comes to the critical care or the terminal illness, we have to think about the palliative care. Palliative care can show improvement in the pain, attitude, balance, coordination of the patient, flexibility, strength. As much possible, try to speed up the recovery if possible in the patient. We have to follow all these methods. If it is a terminal case, the approaches can be different, or we can make a combination of any one or two in this. Either it's a rejuvenation therapy where we can give rasayana dravyas, we can think of doing the balance of the doshas to strengthen the patient, strengthen the disease, or strengthen the disease pathology. We can think about doing mild purificatory procedures. Very important, we have to work on removing the emotional cause of the patient when the patient is ready for it. Think can a separate 7 ways approach. Medicines which can digest the toxins, increase the digestive fire, appropriate drinks and diet, which is very important, exercise, oil treatment, sunbathing, exposure to fresh air. This diagram can show slightly shamana. We can go with mild shodhana, go for pratyahara vihara, yoga, meditation, or soothing therapy. The terminal conditions can be addressed in a different issue level. Either it's a physical issue, emotional coping issue, or it's a practical or a spiritual issue. Physical issue, what we can see in the patient: pain, fatigue, loss of appetite, nausea, vomiting, shortness of breath, insomnia. This can be relieved with the medications using proper methods. We can go with the nutritional therapy, physical therapy, deep breathing techniques. If it is emotional condition, then we have to think about how to address the depression and anxiety, fear in the patient. we need proper counseling, we need recommended group of people who are experts in counseling. We can hold also some family meetings. There are some practical issues. What usually patients are worried about their financial conditions, their legal worries. So such conditions, if it is employee, the concerns will be little different. We have to take help from the advanced directives who can help in the handling the practical issues. Have to think about the spiritual issues. This is very important. Whatever the patient believes, whatever the values of his moral values, we have to sense that, and we have to approach in that way so that patient is ready to accept it with the appropriate manner. These are the main areas where we have to work regularly day-to-day basis. That is the interventions we can use in a palliative care practice. One is we have to think about the artificial feeding and hydration. We have to think about wound care. We have to work on urine and bowel-related issues, ambulation, some of the therapies, specialized therapies. We have to think about sleep management and pain management. Artificial feeding and hydration, which is very important to maintain a healthy status, or we can say not to deteriorate further. We have to maintain a proper hydration. So when the patient comes, sometimes they come with either a nasogastric tube, otherwise they come with the endotracheal feeding, where already gastrotomy procedure done, already there is abnormality in the gastrointestinal absorption, or any severe neurological condition where patient is not allowed to take food. So such patients, when they come with a tube feed, we have to think about the nutrition. Generally, the condition, it is given that 30 kilocalorie, the nutrition is supplied per kg per day is usually supplied to a patient. This quantity is fair enough. Usually what the aspect is that the micronutrients should go enough to the body so that patient will not lead to a deficiency state, and also they will try to balance the metabolism. Here the big role what I feel Ayurveda plays is to understand the Agni and Koshta of the patient. Patient can be in a conscious state or a unconscious or maybe a delirium state, but we can also handle the patient by checking their how much urine output, how is the bowel evacuation, per abdomen examination, pulse examination, we can do Nadi Pariksha. Along with that, we can plan any medications which is good in digestive disturbances, we can give through the tube feed. Only the thing we need a recurrent method to clean the tube more frequently, and also the medicine should be well thoroughly prepared so that it will be easy to introduce to the patients. Whenever we think about feeding or hydration or the food, Ayurveda has a significant role in providing nutrition. Food satisfaction should have also health benefits. We have broadly described classically chapters we find in our all classical texts, we find in Vaisheshya Kalpana also, where a lot of Ahara Kalpanas are mentioned. That starts from a light form of a Ahara to a Guru form of Ahara, which we can plan according to patient's dosha and also patient's Koshta Avastha. So it can be a Kwatha, it can be a Yusha, Yavagu, Shadava, Panaka. It can be given to the patient. Manda and Yavagu, those are the rice preparation with a different variation amount of heat is used, variation amounts of water is used, the consistency is prepared. Based on patient's digestive capacity, it can be introduced to the patient. If patient is good enough, we can go with Mamsarasa, we can go with Takra Kalpana, we can go with Raga Sadava. Also, we can use some of the Mantha Kalpanas. Raga Sadava is basically pomegranate juice along with rock salt and sugar is added to that. Mantha Kalpana hits little guru, also slightly cooling for the patient. We can give in different combinations. Either it's a milk preparation we can add sugar, meat soup, we can add some of the fruits. The main intention to give nutrition to the patient, which has also some health benefits. When we do the same time, if possible, also we can think of some of the herbs which can be incorporated while feeding. It can be either a Deepana Pachana Dravya or a Anulomaka Dravya, Vata Samaka Dravya. Patient's specific based on the symptom or the condition, we can think about either some Swasahara yogas we can add in the Yavagu, we can add Brahmana Dravyas which can do a great amount of nourishment to the patient. Then we have to think about the Matra. how much we should give to the patient. At least the food, whatever we give, it should digest in 3 to 4 hours based on the patient's abdomen examination and the face expression, or if possible patient is talking, then it is good enough to decide how much matra give to the patient. Wound care, especially, we need at least properly, we have to do possible twice, thrice proper dressing to the patient. Acharya Sushrita explained very well the 60 types of Vrana Upakrama, where we can do lot of treatment for the Vrana. We can do Vrana Karma, lot of dressing procedures. We can do Vrana Dupana, Vrana Ropana Chikitsa we can do based on the condition, what we see in the patient, either it's a Paitika type or lot of clathers. Based on that, we can decide what dravyas we have to use. If it is a Kletha Nasaka, we can use Tripla, Panchavalkala. If it is more of Rukshata, we can think of giving some oils like Jatyadi Thailam. We can think of Nalpamradi. We can give up even Eladi coconut, Champurudi. We have lot of medication which has a good Ropana quality we can use in that. Along with that, we have to give some dupana to the vrana, so that whatever bacterial infection or the higher amount of slough can be easily removed with the dupana. Gugulu, Tagara, Vacha, Nimba, Trifala, Sajjarasa, this all can be used as a dupana chikitsa. Also, we can use simple honey, few medicated oils, ghee in proper dressing. Along with that, we have to see the environment of the patient where it is lying, because he is using the clothes, the bed, everything has to be cleaned properly. And the clothes also can be dipped with some medicated herbs after washing, so that it can be made it into bacteria free. Also, the room has to be given proper dhupana with the Gugulu, either Nimba or Vacha or Shallaki, some of the drugs we can use and give the dhupana, so that his environment is free from bacteria. There is another concern about the urine and bowel issues. Like we say, when Vega Avarodha happens in the body, immediately Vata increases. We have to see that there is no Vega Avarodha in the patient. We have to work to remove Apana Vayu Vikriti in the patient. Once we can do Apana Vayu Vikriti, we can find improvement in the Samana Vayu and the Prana Vayu. So the patient will have increased appetite, have little breathing capacity, everything can be increased. Once we do Avarodhana, we can remove the Avarodha from the body. Here we can think of giving a lot of vasti, either it's a Anuvasana vasti or a Nirva vasti. Drug medications we can choose based on our need. Either it can be a Sahacharadi Thailam, it can be a Dhanvantra Meligupakam. We can think of Nimavratadi castor oil, we can think of even Jatyadi, Murivena. This all can be used as a Anuvasana vasti. Wherever needed, based on Dashamula, Irandamula, this all we can use with honey, rock salt, Shatapushpa. We can use a Nirva vasti and can be introduced in the patient. It is, as we say, Ardha Chikitsa in the bedridden patient, it has a great role. It evacuates the GI, lubricate the GI tract, evacuate the urine bowel. It and also it gives little vigorous or the energy to the person. Ambulation, because once the patient is not mobile much, not moving, not able to move properly, even in few steps. In those conditions, we have to think about how to make the person's, the limb parts, we can see the, at least the hand and leg movement is there always. So we can do some of the therapies. If they are doing physiotherapy, we can also incorporate with physiotherapy, if possible, light, mild yoga. Along with that, we can go with Snehan and Svedana Chikitsa, which can maintain the strength of the joint. Muscle tone can be achieved. This also will help at least to move the person to feel little lighter and energetic. And those patients are bedridden, they have a high chance to make complication in the bed sores, along with a lot of thrombosed formations, and also they become dull if they are not moving properly. So when we do Abhyangam, Sirodhara, Nasya, Kannapurana, Gandusha, Kavala, this all helps to make patient little more flexible, and possible they can be little vata can remove vata from the body. We can think of specialized Panchakarma. What I feel Vasti is the best treatment, which definitely we should do all the palliative care centers. based. The Basti, we are known to be anti-aging. It can improve good strength, Agni, complications, complexions. We can think of cognition power. We can think of quality of living. Everything can be partly improved. If the patient also in a tube feed, also we can think of, if patient is already on radiation, chemotherapy, also we can think of giving Vasti. We can give lot of therapy. Even we can give lot of milk preparation as a Vasti. We can think from a milk preparation to Mamsarasa to specific herbs. Even Yapana Vasti, we can give lot of variety of Vasti, which can strengthen the whole gut, which can improve the bacteria flora structure, which can take out the Vata and improve the quality of life of the person. Even we have seen our classical text where Acharya Charaka mentioned about the Pichavasti, that the goat's blood is introduced in patient. Very important, the sleep. If patient is not sleeping, it is very difficult to heal the body. Patient has to sleep in the night properly. We can do something which is very soothing for the patient, like light massage. We can give proper bathing to the patient. We can apply some oil massage in the head. We can do regularly. We can give Anupama Amshadravya if the patient can digest. We can think of giving Shali Rasa with yogurt. We can give of Takra. We can give whatever the patient feels happy. Either it's a music, either it's a smell, aroma, anything, or it's a light sound. We can do also Netra Tarpana. We can apply some of the herbs on the forehead. We can apply on the head as the Talapudichal. We can apply. Also, we can do, we have to see that the patient bed is very comfortable, so that he can have a good sleep. Very important, this is from the patient points of view, is the pain management. The terminal ill patient, they deal with a very intense pain. And also WHO has given a specified guideline how to maintain the pain in the person. But whatever the patient they suffer when they do Ayurvedic intervention, the intensity, frequency and duration of pain episodes can be reduced. We can start from Abhyangam, Svedana, Snehana, Sirodhara, Vasti. All this we can incorporate during our treatment. And also we can see wherever the drug induced, either morphine induced, chemotherapy induced, patient have more intense pain or the constipation, everything can be handled with all these therapies. Here possible conditions, like we can see here, like how we can do the bowel management, if it is a neuropathy, if it is a chemotherapy induced pain, if it is a peripheral neuropathy. We can think about the oral hygienic, oral cancers. We can think about the nutrition aspect. We can think, and these are the formulation which day to day we use even more based on Yukti. We can add more formulations to our practice, and the procedures we can do all this like Snehana, Svedana, Matravasti, Dhupana, then Nasyam, Sirodhara, Talapodichil, Gandusha, Dhanyamlam, Kshiradhara. All this treatment can be used for the patient. Through this traditional system of medicine, we can achieve a comfortable and a health maintaining status in the patient. Ayurveda can play a crucial role in various facets of palliative care, including diet and nutritional support, sleep management, wound care, pain management, mental health support, and immunity. In terminal illness, the patient is, at that time it's not important to cure the illness, but the prevention of complications and prolonging the lifespan with comfort. Ayurveda system of palliative care helps to improve the quality of life. Thank you for your patient hearing. Thank you so much.
I'm so happy that we waited this long. I know it's very, very late in India, but your presentation has really brought a very comprehensive coverage to what we are discussing today, and you've touched on all the key points. Now, I don't know, India time, it's very late in Kuala Lumpur.
Yeah, it's 11:37.
Unless you're going out to the party or something, I don't know. It's already very late there in Kuala Lumpur. It's very late in Delhi, in India. It's almost, it's 4:30 here. It's 10 o'clock, 6 minutes past 10 in India. It is well beyond our normal.
6 minutes past 9.
Oh, sorry, 6 past. Okay, so we still have a few minutes. My apologies, I didn't do my calculation here correctly. But we have, you have seen today, so number one,
today Pawanji is alert. So probably he's interested to make it finish by say 20 minutes, coming 20 minutes.
We'll try and draw this to a close because we've had wonderful presentations. I want to thank Pandey ji for drawing Anjali ji and Anita ji to the platform. Pandey ji, grateful for gratitude from all of us here for bringing all these wonderful people to us on a very important topic. Anjali and Anita ji, you are somewhere in Malaysia. Thank you for joining us and sharing your thoughts and your wisdom and your experiences here. Bernie, Dr. Colasso was very, very happy that he could meet with everybody here and to raise one or two comments. And Pandey ji, Dr. Colasso sends his special thanks to you and wishes to discuss further how to develop some kind of informal collaboration leading to something else between United Kingdom, London Health Service, and the work that you are doing in palliative care, and how we can have an interaction here. And I think the time is right. There are many discussions going on between India and UK in the healthcare sector. Last Thursday, we had a big meeting at the Royal College of Physicians on India-UK healthcare, and the discussions are going on. So I'm happy that this event has brought together the collection of minds discussing a very, very difficult and a very, very important area. And thanks to Bernie ji, who's joined and pointed questions to rheumatoid arthritis and the distinction between psoriatic versus rheumatoid, very technical things. They understand these problems differently. We understand it differently. The language is different, but I think there is a commonality. We have one question. Before Ravi Gogia ji is here from the Panchakarma section of Delhi government, and Ravi ji had a question. But before I bring Ravi ji on, I just want to pick up one or two points here raised in Anita ji's talk, in Anjali ji's talk, and Pandey ji in your talk also. The difficult one, which we take for granted, this is to do with prana. And we understand, and Anita ji has shown us how you can manage the different vayus and how you can actually enable better flow of prana within the system. Now, how can we engage with the rest of the world with something we understand so well in Ayurveda and yoga, and we have special techniques to improve? But we can come back to this. I just want to invite Ravi Gogia ji. Ravi ji, namaskar. Thank you for joining from Delhi. The floor is yours, Ravi ji.
Good evening to all. I'm very thankful to Dr. Anjali and Dr. Anita Panda. Dr. Anita Panda belongs from Odisha. I did my PG from Odisha. I can talk to her in Odia language also. So this is very interesting language. Second thing, I am very glad that Dr. Anjali has covered few matters regarding diet. Food with high pran value. I would like to know what are the food products having high pran value. I would like to know about this. Second thing, she has mentioned two mantras of healthy life. Eat only whenever you are hungry. But there is something missing which I wanted to see. That was, I think so. As per my funda, we should drink water as whenever we are thirsty. That should be mentioned. I think so. This is my funda. Firstly, eat only when you are hungry and drink water whenever you are thirsty. That should be also there.
Yes,
and third
yes.
one is the smoothie. In foreign countries or in a modern area, all people, new generation people, new lad and lasses, they usually have smoothie. Smoothie means any fruit combination with milk. They are having juices of fruit along with milk. But in Ayurveda, that is viruddha. Any fruit that should not be mixed with milk, that will not create good stamina in the body. That can create ama also. That can reduce our jathagni also. So, but Usually people, they consume banana shake, mango shake. Is it right or not? Please just share your views about it.
Thank you, Raviji. Thank you. I don't know who wants to address this question. Anjali, do you want to take this question, please?
Dr. Anjali, please.
Yes, yes, I can. You know, whatever he said is actually true. I missed to mention that. Regarding Viruddha Ahara, taking smoothies not only with milk, it's a habit of people to make vegetables, fruits, nuts and seeds together with yogurt and milk in the morning. So it's been widely practiced even here, I think rest of the world too. So in everyday routine, you know, we tell our patients not to do that, especially those people with high inflammatory parameters or, you know, autoimmune conditions. Definitely it affects your acne. It leads to the production of pharma, and it can impair your digestion and metabolism. So it in turn affects the recovery from illnesses as well. And regarding water too, definitely it is recommended to drink water whenever you are thirsty, and to drink warm water as much as possible, except maybe in summers.
Okay.
Thank you, Anjali. Thank you. This question about, I think, Raviji's question about sattvic ahar, how do you understand this? Also, prana,
high prana value.
High food with high prana value. Yes.
High prana foods are generally, you know, that are more sweet. Sweet doesn't mean cakes or, you know, sugar or anything. That it's more of grains, carbohydrates, which are of easier for the digestion as well as assimilation. So I would say, like, I think I listed down a lot of foods which can be taken on a daily basis. That all foods come under high prana food. Red rice, you know, Indian gooseberry, rainwater, and moong dal, moong bean. All these things are actually high prana foods, and you can avoid too spicy, too sour, pungent foods in general, and like maybe onion, garlic. All these are more of rajasic and tamasic foods. So try to, it's again a very big topic to be discussed, the prana, sattva and rajas. That's why I didn't really touch that topic today. So in general, I would say you can have more of carbs, which we are habituated to from your childhood. That has a very good impact in your body. And as I said, like all the other things, eat when you're hungry, and, you know, maybe exercise on a daily basis if possible, those who can, because that again has a effect on the ama, you know, production as well as removal from your system. So these are some of the points we can add on.
Thank you, Anjali. You know, the question you had highlighted both in your presentation and also in Anitaji's presentation about pesticides and things like that that are there. So it comes into the area of good agriculture practice also, you know.
Yes.
There is a way of connecting all this with good agriculture practice, which means food and whatever is the nutritional quality of food goes beyond just the kind of foods, but also the way it is grown and the way it is preserved or brought to the table at the
Yeah,
given
there
time.
is a saying as if, you know, whatever or every time you put anything into your mouth, you are either feeding a disease or you are getting healthier. So it's absolutely true.
Beautiful. Anjali,
repeat this phrase again, please.
Every time you put, could you repeat that one, Anjali?
Every time you put something into your mouth, you are either feeding a disease or you are getting healthier.
Okay, this is the right phrase. Very good.
Anjali
diet is our best medicine. Diet rest. Diet is our best medicine. There is no need to have anything medicine if you are having great diet.
Thank you,
yes, yeah, true.
Thank you, Raviji. This is a very big area. I think Pavanji will bring us all back together again in one of the future events on this topic about new descriptors of quality of food, you know, aspects of prana. I wanted, Raviji, thank you for raising this point. It's come through again in one or two questions. I want to just read out, Hema Malini is one of our frequent presenters here. And Hemaji has sent a question saying, Ojas, Paraojas, Aparaojas, and impact of genetically modified foods or foods produced using unnatural production techniques, you know. So the concept of ojas that I raised in Pandeyji's, following Pandeyji's presentation, we are talking about the same thing. We are kind of going around that idea of something about sattvic ahar, how to make that food, but also how to see the effect on the human body. I think there is, Bernie, Dr. Colasso might say, well, measure it and show me what the effects are. And I feel it is possible, maybe it is possible to measure this in using some modern biochemical procedures or some cell biology procedures, but we might also be able to take the help of instruments like Nadi Tarangini, that is made by Anirudh Joshi and his team in Pune. And more recently, he has an improved version of that instrument and he calls it Turiya. Turiya is an instrument that is being made in Pune by Anirudh Joshi and his team. That is one example that comes to mind. I would like, Anitaji, I would like to give the floor to Dr. Pandey, just to give some impressions and then come back to each of our speakers, just to give your impressions of where we want to go. I've already mentioned to Dr. Pandey and to Bernie that one outcome of today's event could be establishing some kind of a research interaction between London and BHU. Is one possibility. Professor Pandey, I leave it to you to just distill what came through out of this interaction today and whether it has opened some new thoughts in your mind, whether we have reached some quality conclusions or where you would like us to go in the future.
Well, thank you. First of all, I would like to express my sincere thanks to coordinate you, sir. The way you have coordinated and asked the forum to interact with each other. Many things came into my mind that first thing, whatsoever is mentioned in the text, that must be proven on scientific parameters. And it is not very easy to tell about to prove about the concepts of Ayurvedic text or Ayurvedic versions on modern parameters. But for that, we have to design some module to establish certain parameters on which we can scientifically prove that this is here and that can be comparable to modern medical parameters. Second one, this is very burning issue of terminally ill patients. There are many more factors, and those factors must be considered in each and every, or you can say all respects. I am thankful to Dr. Anita and Dr. Anjali. We never met, we never chat, but through CB, he suggested me 2 names and gave the contact numbers, and then I discussed them. And very shortly, they were kind enough to share their experiences on this very platform and highlighted the guide factors and lifestyle. And many times this question, as the Dr. Seshal raised, that how yoga is going to be in terminal ill disorders, and how we can design or interact or collaborate with the London. And we have to think and we have to discuss either 2 or 3 table discussions, then we can find that what is the easiest way and shortest duration. Because if we interact, we collaborate with each other, that project takes a longer time. After that, the scenario or the picture of the disease and the parameters will change because science is developing day by day. And in terminal patient, many more parameters can be assessed. Regarding yoga therapy, whatsoever we are doing here, that will definitely either within 1 or 2 years, we will get certain parameters to be proved on scientific parameters. Last visit in the last month of last day, 20th and 29th, I met to Dr. Balkrishna, the director of the Patanjali Yoga Sansthan. We had a discussion at Uttarakhand, Dehradun. Then we had discussions regarding the certain Ayurvedic painkillers. Someone has raised the question which Ayurvedic drug is more potent or acting like morphine. But my dear friend, morphine is the derivative of herbal medicine. The scientific revolutionary changes, especially in ICUs, CCUs, came into existence only because of the Ayurvedic drugs. Cocaine, you can say, morphine, ephedrine, and a lot more have been derived from. But when they isolated those active principles, up to 99%, they coined it as a modern medicine, and up to 98% purification, it is herbal drug. So this myth must be broken. So we have to think the Ayurvedic formulations according to Ayurvedic principles, according to the quality and the category of the patient, according to the climate of the patient. It is mentioned in the text of Ayurveda. That can be considered. And apart from that, any non-pharmacological approach must be tried. That will be economical and harmless. It may be yoga, it may be counseling, it may be sattva vijay, it may be daiva upashray, but this not only curtail the side effects of or the problems of a patient or the family members, but also it will reduce the ill effects and improve the quality of life. On one hand, we are maintaining the wall of a falling from the storm, and other hand, we are repairing it. It will not be acceptable. We have to think, we have to improve in respect. We have to apply the holistic approach. Regarding the ojas, sir, anyone have seen ever the pranas, from where it comes and where it goes? But we find that there is a certain immune system and immunity. Have anyone isolated the immunity from any person? No. They have just hypothesized that this is because of the T cell, this is because of the B cell, this is the inherited immunity source. But say for that, if we go through the process of the formation of the dhatus, rasadraktam tato mansam mansad mega prasyayate, means subsequent dhatus formation is because of their proper metabolism, and the byproduct is as malas, and the main product for the metabolic or the development of that particular tissue and for the precursor of the next dhatus. And likewise, when there is a formation of the shukra and ultimate formation of the ojas, up to shukra formation, there is a immunity, and it is well known, well in practice, and we can find that the supraksha is there, definitely there. But the characteristic features of the ojakshay, oja bibhrans, and oja vyapad, these are the three problems, are the pathological conditions of the ojas, means they are resembling with the clinical presentation of a disease, by which we can say that there is a problem with the ultimate resultant of that paripak of the ahar or the process of the dhatus. And that is to be understood in a pharmacological, in a physiological formulation, that is to be reflected by the, and that to be assessed by a physician, and that requires a close observation, not that one that is laboratory parameters are there we can. While analyzing or assessing or observing our patients on negative ojas scale, that is meant for the quality life assessment, I have observed there are many questionnaires, there are many observatory parameters on which we found that the ojas is responsible for the better quality life. And that is only on the physiological presentation of. Likewise, the vata. Vata is not visible, but according to the physiological function, we can say that tatra ruksho lagu sita khara sukshma chalo nila. Means these are the physiological function, are the specific characteristic features of that particular dosa, on which we can say. And when we go into details, it takes a long discussions and long presentations that we can present that this vata has that particular qualities, and on the basis of that we can say the dosas and the panchama bhautik, they are the basic building materials of the cell. And when cell is functioning properly, the proper formation of the ooza will take according to its ladder step time. And that ooza is the main immune factors.
Thank you, sir.
For collaborating with these aspects, yoga, how yoga is, because yoga improves the prana, where the prana is. Text is mentioned that dasayu ayatanyayu prana yesu pratastha sankomar batram kantham dojasam. These are the specific sites where that vital function, vital energy is in bunch, and that to be protected. And when we talk about the prana, where it flows through the all channel system. Shroto mayo ayam purusha means when there are the flow of life that is within the cell and between the cell. Intercellular and intracellular energy flows that in the form of prana. When it crosses to the semi-permeable membrane of the cell, it goes inside the cell and performs its physiological characteristic actions. When it is distorted or affected, or it is not in a balanced property of, because it carries all panchamabhotik tattvas. It carries all tridosas properties according to prevalence of the diet, nature, climate, condition of the patient, and their digestion, assimilation, Kidari Kulyana, receptor theory, and the channel system. It takes a lot of flow of the energy. And that's why Deho Hiya Ahara Sambhava, as Dr. Anita said, this is the pranic food. Means this body is only because of the anna. Anna, that is the suitable to a particular individual, and that carries the energy. And that energy is there, complex to simple, simple to complex, and other according to receptor and other things. And it goes inside the body, it takes time, and it takes the acceptability or the affinity and its antidote type. And so it is get assimilated inside the body and is created by building of the next dhatus and ultimately goes into the ojas. And that ojas is the energy, is the immune power of a person. When a patient is sick, definitely there is a loss of gradual decrease in the power of specific dhatus. Ultimately, there is a decrease in the ojas. And that is maintained by the Ayurvedic system. And the pranayam does performs what a cell needs. Cell needs only energy and the oxygen. Pure oxygen is the of the pranayam. That's what the pranayam is there.
Sir, we have lost your. Oh, we have lost Pandeyji's audio signal. Agnihotra ji, can you hear me? Hamare awaaz aa raha ji?
Yes, very well, very well. It's very clear.
Pandeyji ka cut gaya beech mein. But we feel
no problem, sir.
Pandeyji beech mein cut gaya, but we will continue this. Listening to you, we could sit here all evening, sir, and listen to what you are offering us, because it is so wonderful the way you are stringing the difficult concepts together and the difficult areas that people find so difficult to understand. You are putting it all together in such a clear way. And I feel that if we can somehow form an informal interaction, maybe with Uttarakhand, with Banaras, with BHU and London, and just open a dialogue so that we can enable some young students to come into this discussion to take it to the future, into something. So because of time, 9:30 now, Agnihotra ji, our discussion has been wonderful. Our presentations have been enriching. Anita ji, your presentation at the very end, you brought a lot of things. Now keep in mind, all our presentations are archived, so you can visit this anytime. Apologies for the quality problems we've had occasionally, the communication problems, but at least you have the presentations. We can revisit those and present them and put them together more clearly for people to enjoy. Anjali, your presentation, and Anita ji, your presentation, both were wonderful. I want to thank Domaji for staying with us. Domaji, shortage of time means we will have to cut short. But before I pass the floor back to Pavanji to carry on, I want to invite Anjali ji very briefly for a minute just to convey feedback on today's event, and the same, Anita ji, from yourself. You remember my visiting AVP Coimbatore. Thank you for remembering this. And Anjali ji, the floor is yours. Please tell us a little bit. Now, I have a question here. Somebody says, who is this mysterious person, Sibi?
Okay.
Who is this?
Dr. Sibi has been practicing Ayurveda in Malaysia, I think, more than 20 years. So he's the pioneer in bringing Ayurveda here in Malaysia, and he's quite famous. The name Ayurveda and Dr. Sibi is almost synonymous with each other here. He's quite popular.
Where can we find this person? Could you put Anita ji?
He is actually a colleague of Dr. Anita. They both are working together. So yeah, she might be.
Anjali and Anita, and also Pandey ji had some information, but we didn't have your contact details in the presentation.
Oh, okay.
So please put your details in the chat box. Anita ji, the floor is yours. Thank you.
Yes, sure.
Anjali ji, sorry, I didn't get some feedback very, very swiftly.
No, definitely. It's been like a very good platform. Like, I came to know a lot of legends in Ayurveda. So compared to all of them, I am like really, really junior. I have only maybe 10 years of experience. I think they probably have 20, 30 years of experience. So it's very nice to meet all of them and, to have for them to share knowledge, and it's really a very good opportunity for me to be here and to present along with them. Thank you for all the organizers.
Do you connect with people in Singapore at all?
Yeah, I do know some of the doctors who are practicing in Singapore. It's only like 4-5 hours drive from here in Kuala Lumpur. So yes.
If you share, Anjali ji, if you share your contact details, wish very much to stay in touch. Anita ji, the floor is yours very quickly. Some feedback about today's event, and thank you.
I know. I'm very sorry. My apologies that I joined a bit late.
Never mind, we enjoyed your presentation.
But it was very interesting and I liked it. I feel myself very privileged, and also I look forward the decision what was taken to collaborative do some research. That is the outcome what we are looking, and also it is a good if we can make more in a qualitative to a quantitative form. Then also it can be made as a like a protocol for the youngsters, so that it will be easy, because Ayurveda always we learn with the seniors with a group of setup, and then we work and then gradually we learn. And once we practice, sometimes we little neglect regarding the documentation or to objectify that, sometimes we miss it. So once we have this platform, it will be very good, and people can learn. Ayurveda faculty also can have a proper protocol so that it will be easy for them to practice. Thank you so much, sir.
Thank you. Anita ji, you are going to be guiding us in these discussions. So please keep connected with this platform.
Sure, sir.
You don't need to be invited. Your details are there with Pavanji, and he will update you on future events. Wherever you feel you can join us and guide us to grow this activity, we welcome this.
Thank you.
Your help.
Definitely.
And your point about research collaborations is important. Malaysia has many modern medicine colleges and institutions, and Singapore too. And we want to see how we can interface this, just like Dr. Bernie today was saying, how to interface our Ayurvedic systems with the technologies and the techniques and the thinking that's available in the contemporary medical institutions, because they have the techniques that we need, not that we don't have. I gave the name of Anirudh Joshi ji, who has developed techniques for pulse diagnosis. And they can all be used in this assessing prana, assessing, understanding aspects of using Ayurvedic thinking and Ayurvedic parameters. So, but we need students, we need to have a platform where we can do this research so that we can make this dialogue happen. Thank you so much. We'll be grateful if I could take your contact details, Anita ji, here on the chat box. With those few words, thank all our three speakers. Pavanji, another amazing event. You have brought us all together on the 381st webinar, and a very valuable, very important topic, and a very significant outcome. I will discuss offline with Pandeyji and with Bernie here in London, and with our colleagues from Malaysia on how, and with Agnihotriji in Uttarakhand, how to bring some kind of a interaction so that we can refine this further. Pavanji, back to you. Thank you. Domaji, namaskar.
Madanji, for a while, one should not be unanswered. It's a short one that para ojas or apara ojas. There is no like terminology that para apara for ojas. Ojas is ojas. And if it is converted to para, then it is called tejas, not ojas.
Achha. I don't know, Agnihotriji isn't agreeing with this.
It is tejas means spiritual oriented. Ojas means body oriented.
Achha.
That is the distinction in between of ojas. Ojas is not para and apara. When it is converted tejas, for example, seeing one's face, what a glance and what a tejas is there on his face. It doesn't mean that in only the spiritual practitioner can expose his tejas, not by words. Should be on observance. He should not tell that I have developed much tejas. No, one should observe that you have developed tejas by your spiritual practices and austerity. This is called. And that there is no terminology for this ojas, para and apara. Para means only for Brahma, and apara means that is for Nirguna. In one talk, we can say that is for Nirguna, and apara is Saguna. That's
okay. Maybe, I think, thank you, Domaji. As always, you are making us think harder about some of those concepts. Thank you so much, because from, I think, Anandamargi perspective gives us a richness that might not be easily accessible to ordinary people like us. I think so.
For scientific case, it is open and they can assess on any parameter. About Anandamurti's explanation, he didn't keep it in traditional way. He didn't keep at all.
Yes.
He has opened in scientific way and explained also. That is why science age cannot challenge Anandamurti.
The point you raised yesterday of transhuman is also very important in all this. I think we will come to this. You know what Sri Aurobindo would say is, man is a transitional being. Man is still progressing. He is evolving, improving, going towards perfection, towards becoming that, becoming Nirguna at some point, I suppose. We'll come back to this, Domaji. I'm looking at the time here, 9:30, 9:40. I leave it to Pavanji. Pavanji. Domaji, thank you so much. We will come back to this. I'm so happy that you are with us in every program, catching us if we take some deviate from from those fine aspects. So we are eternally grateful for your guidance. Pranamji.
Thank you, sir.
Pavanji,
namaskar. Thank you very much, sir. Now I would like to request Professor V.K. Agnihotri, sir, for his valedictory remarks. And 2 days gap is there, sir. No webinar on 24 and 25. Now 26, Ayush in Buddhism, health in Buddhism. So 2 Buddhism expert will guide us. And then on 31st, quit tobacco.
Quit tobacco.
Yes.
Thank you, Pavanji.
Agnihotri, sir, welcome.
Thank you, Pawan Sharmaji. Namaskar, Professor Madan Singh-Gulji. Namaskar.
Namaskar ji.
Just to catch the tail, though I have got no dare to interrupt even any word spoken by Professor Dr. Domaji, but what we learn through physiology of Ayurveda or Sharir Kriya Vigyan, Rasadinam Sukrantanam Dhatunam Yat Param Bala Tat Tojah Tata Balamiti Uchite. And that there the Oj is divided or described in 2 parts, Par Oj and Upper Oj. and it has got 8 bindu quantity that resides. The seat of that Oj is heart, and the Ardhanjali Pramana Ojas is throughout the body. Anyway, there will be some other reference and text. So when it becomes Tej, it becomes divine, it becomes aura. And so great persons like Ramakrishna, they were having the aura around his head. So that itself a different becomes a different issue. But the pleasure is this, that today Dr. Pawan Sharma is alert enough and awakened, and he is watching that what we do till 10 p.m. So he's a great, what we are doing for last 2-3 days up to 10 p.m. Anyway, so first of all, I would like to extend our regards and respect to our all senior dignitaries who ornamented our today's webinar's platform, and they are Professor Madan Tangveluji, Dr. Pawan Sharma ji, Dr. Jagdish Doma ji, Vedrajan Patankar ji, Professor P. Sudhakar Reddy ji, Dr. Preeti Banerjee ji, Dr. Ravi Gogia ji, Dr. Naveen Gupta ji, Dr. Sudeep Bagga ji, Dr. Renu Rathi ji, Dr. Rampal Samani ji, and definitely from London, Professor Barney ji, who is a well-known and very senior rheumatologist. So, very nice topic of today's webinar, which touched our next step, that is 381. Professor B.P. Sharma Saab inaugurated our today's webinar with the remarks and extending their welcome to all our dignitaries and our guest speakers. And then Professor Madan Tangveluji touches the basic literature available and value of today's this concept, that palliative care in Ayush. And meanwhile, I also searched, I've got a few minutes to search out in Google, and I found that NAPCAIM is one association, that National Association of Palliative Care for Ayush and Integrated. So this has been well in knowledge of WHO, and it is doing a lot of work, and the association members are there. I think Professor Tangvelu sir quoted from Kerala. So our 3 expected speakers were as a guest speakers. They thrown a wonderful light, and especially Professor K.K. Pandey sir, he covered the whole area, whole maximum possible area related with the life of a person, life of a human being, life of a patient, and a person who is suffering at the terminal stage of their disease. Along with Dr. Anita Panda and Dr. Anjali Rajeevan, they both especially specified or emphasized over the dietary status of the patients or those type of patient, along with the hygiene maintenance. So in this way, this was the area. I would be pleased if Professor K.K. Pandey is there and listening me. I have seen the list, but he is not there, and this is my unfortunate, because he has covered a lot. He has covered everything, but what he left, I am here to add on. This is my humble request. Otherwise, he will see the our archive YouTube. See, when I talk, it means I am the last person in that, when I have heard everything, whosoever been given lights to and inputs to by their presentations. I have got at least 2 references in connection with the word. Professor Pandey told that to speak a very favorable words to the patients is wonderful. Means आप ठीक हो जाएंगे, आपकी तबीयत ठीक हो जाएगी, आपकी तकलीफ में सुधार हो जाएगा. ये communication with the patient, it itself relieves a lot. And for that, I just referred our Ramcharitmanas, where twice it is been uttered like something, that is, nothing is equal to the speech. Vani Sama. There were 2 chronic conditions where the life and death was just can take the place. The one is when Hanumanji reached Lanka and searched about Sita ji, and when he narrated all these things to Ramchandra ji, so in itself, our in Lanka Kand, का देऊ तोहि तैलोक महि kapi kimap nahi vani sama. There is nothing at part to the vani, the speech, because it is Hanumanji who informed that Sita is there and intact, and the research was completed, and Ramchandji was speechless. He told like this, as Tulsidas ji narrated, that ka dev puran kam tohi tailok mo kimap nahi vani sama. This is reference from Ramcharitmanas, Lanka Gad 106, this Loha. And then again, the same condition happened when Bharat, the elder brother, I'm the brother of Lord Rama, was waiting for last 14 years that when he come, when Prabhu will come or not. And as Hanumanji reaches there, he told that Ramchandji has come and he is just reaching. He has sent me as a messenger to say that you be now rest. I am here to come. So he says, Sunat Bachan Bisre Sab Icha Teshavant Jim Pai Piyukha. Here the Vani has been adjusted as Piyukha Amrat. This is again in Sundar Uttarakhand, first shloka and third chopai. So this is very, very important, that Vani is important, and we doctors, physicians are supposed to say something in a favor of patient, and patient the same moment relax. We know the moment the agony of the patient at the time of entering our OPD, and after taking his version, his history, and when we say that, well, you will be okay, take medicine, the face reading changes. The soothing effect comes over the face. Now, two other points were also there, which partially touched by Professor K.K. Pandey ji, as put forward by Renu Rathi ji, that morphine versus what? Can anything be able to be there? And it is surprised to me that nobody touched about the marma therapy. Though number of universities has taken and given the recognition, the diploma courses started in Dev Sanskrit Vishwadhyalaya, in Gurukul Kangli, in Delhi, etc. Different universities. So it will be the marma therapy, which without say non-pharmacological therapy, it will work. So this one thing is there, and at the same time, as Dr. Pandey is told that Satta Vijay will do a lot, so goes the case with the chanting of so many types of Omkar, Om Mantra, or Brahmari, Udgit itself. This will do. These are the part of our yoga. And one thing is that Nase Rog Hare Sab Pira, all sorts of Pira, all sorts of Vedana, all sorts of pain will be removed with the chanting of the Hanuman Chalisa. So these things can be taken. And one thing he told, Professor Pandey told that Veda therapy. So I would just like to make it more expanded in a form instead of Veda therapy, because we Sanatani can say like this as Veda therapy. At the same time, we would like to say that all the religious books of all religions may be of great help in the same manner as Satta Vijay. So we may go for Veda therapy, they may go for Bible, they may go for Guru Granth Sahib chanting, they may go for the their Quran's recitations. So this will, because this all gives the mental peace, this all gives the psychological upliftment person suffering from other thing. As he told that there will be a deviation of the concentration from the pains if we involve them in games or badminton or in that way, because we also been taught in the same manner. When we start sitting on Sukhasana, the lateral malleolus of our ankle joint, it always presses over the earth and we feel pain. So our teachers who used to say, who is receiving the pain? Your body. Keep away your body. You are talking with the yoga chittavritti nirodha. So at the same time, the chitta is to be vrittis are to be controlled. This is what here comes the yoga itself. So yoga, as he told that yoga moksha cha sarvasam vedanam nivartanam. All sorts of miseries are supposed to be returned back when we follow the yogic therapy. So in that manner, dukho ki atyantik nivritti ka naam hi yoga hai. Total cessation of the miseries is known as yoga. So this is to be implemented by at that stage when a person is suffering from terminal stage of any of the disease, like say cancer or diabetes or so many things. Sometimes it happens, you see, family members used to say that this person is having such type of grave injury or diseases, and I don't know when the time will come. Yeah, and we have also heard some words that if a person breathes his last, people say that, well, इनको मोक्ष की प्राप्ति हो गई. He was struggling a lot. बहुत ही कष्ट में थे, इनका शरीर पूर्ण हुआ, तो अब इनको रोग, तो इनको कष्ट तो नहीं सहना पड़ेगा. तो वो भी अगर हमारी लंबी लाइफ होती चली जाए, एक अच्छी प्रकार की बहुत ग्रेव डिजीज का आ जाना इस बात का सिम्टम है कि अब हम भगवान से मिलने जाने के लिए हमारी फाइल पर साइन हो गए हैं. अब समय जितना भी लगे, तो ये बहुत ही बड़ी चीज है. अगर कोई अनादिकाल तक जीता रहे या अनादिकाल तक डिजीज से सफर करता रहे और उसका शरीर न छूटे, बताइए कितनी मुश्किल बात है. उस वक्त कितना खराब लगता है जब पेशेंट के अटेंडेंस को बड़े बड़े अच्छे डॉक्टर्स हॉस्पिटल से कह देते हैं, लीजिए इनको आप घर ले जाइए, अब आप इनकी सेवा करिए. तो पेशेंट्स का अटेंडेंस, फॉर इट बिकम्स द ग्रेटेस्ट रिस्पॉन्सिबिलिटी दैट हाउ ही विल मैनेज for diet, for liquids, for natural calls, attending, and all these things. I have suffered. I have attended all these things with my respected father. He was suffering Parkinson's for last 5 years of his life. So we know all these things. These are very sensitive issues. So one important thing which you were interested to know about the Sangha Haran, and I don't know how he left. I'm sorry that how he left. Here comes again the role of our yoga. You see, you might have remembered, or you might have seen so many videos, and there was probably live demo regarding the tooth extraction on observing our bandhas. So Moolvan, Jalandhar, Dhyanand is there. It is a painless approach to take out the tooth extraction, simply observing the Jalandhar bandha. Here comes our yoga. So yoga has got so many approaches without medicine, and that too, which is helpful for the removal of the pain itself. So total physician will be approached with the help of the yogic therapy. And I am very proud of that. Professor Varni sir told, though he is plus 70 and he is a very senior person and working on the patients of rheumatoid arthritis, along with the application and possibilities of yoga itself. So these informations for him will also go a long way. We can keep on doing something with the help of Professor K.K. Pandey, like pranayam, like anulom vilom, like the observations of the bandha, and so goes with the Brahmari, Ujjayi, and Bhastrika and Kapalvati. So many things. They talked about Shirodhara and other things, but the bandha is very important. Bandha and Marma therapy, these 2 points, I was waiting for my turn so that I could be in position to add on these things. I'm surprised that, especially for Renu Rathi and for other persons, Dr. Anjali and Dr. Anita, both ladies doing very well for last 10 years or 20 years in Kuala Lumpur, Malaysia, and it's our pride feeling that they are Ayurvedic graduates, postgraduates and PhD, and working out of country and managing the greatest form of Ayurveda there in their countries and getting name and fame. It's really quite good for us all. And so today's webinar was very important, as the Vedas are drugless therapy. So goes for the other religious books for other religion persons. It will go in the same manner. So it will also establish the symbiotic approach therapy itself. This is all. So whole of the theme and the heart of the heart, you can say heart or prana, these are to be observed with a common man, a person who is having a long life, like our Advani ji, our senior person of our school. He is also enjoying 95 years of age, who is my teacher of Sanskrit department. He is Hellenarity. So how he is managing, it is also to be observed. A group of MD scholars and PhD scholars are supposed to go those persons who are enjoying their higher age of life and how they are managing. It is also a lesson to be collected from them. Those who are having a senior persons, and also those who are having seniors but suffering from any disease, their hygiene, their day-to-day life, their lifestyle, how can it be made more palatable with the help of the yoga, Ayurveda, and person-to-person contact. This is what they say. If we say that आप ठीक हो जाएंगे, आपका कष्ट जल्दी दूर हो जाएगा, these words will give a real palatable impression and approach in their psyche level, and this will the really result of our today's webinar. So thank you all, and I'm thankful that you have given me opportunity to put forward my words. So thank you all. Professor Madanji, over to Pawan Sharma ji. Thank you.
थैंक यू वेरी मच सर। आजकल कुछ इतनी अच्छी वेबिनार्स चल रही हैं कि वो उसमें सब्जेक्ट, क्वेश्चन, एवरीथिंग इज इन्वॉल्व। एक्सीलेंट सर।
नहीं, आपको निद्रा क्यों आ जाती है? अच्छी वेबिनार में आपको निद्रा क्यों आ जाती है? ये हमारा निद्रा जनन तो नहीं है? अलाबू और निद्रा जनन
आज नहीं आई, आज नहीं आई सर।
क्योंकि हम सब अब बुढ़े हो रहे हैं ना, हम बड़े हो रहे हैं, तो हमें समझना जरूरी है।
ठीक बोले
अग्निहोत्री जी। कभी कभी पवन कुमार भीम, कभी कभी पवन कुमार भीम भी होता है। पवन कुमार भीम भी होता है, इसलिए कभी कभी हनुमान जी रूप में लेते हैं पवन जी, और कभी कभी भीम के रूप में ले लेते हैं।
पवन वेग में सो जाते हैं, पवन वेग से आ जाते हैं।
वो 3 बजे उठने की एक ऐसी आदत पड़ गई सर कि वो अपने आप आंखें झपका देती है। क्या करें?
अयो, आनंद मूर्ति जी 3 बजे ही उठता था।
हमारे प्रोफेसर एनाटॉमी वाले कहते थे बीएचयू में कि पोस्ट लंच सेशन इज वेरी सिडेटिव, और हम लोगों का टाइम 2 बजे 2:15 बजे वाला क्लास जो एनाटॉमी को होता था प्रैक्टिकल वाला, तो वो उनके बाद आता। हमेशा उन्होंने कहा पोस्ट लंच सेशन इज वेरी सिडेटिव। वो एक आध लड़के झपकते थे, 20 लड़के निगाह पड़ जाती थी, तो वो कहते थे ऐसे ही तो होता है कई बार।
ठीक है, गुड नाइट सर। थैंक यू टू ऑल। गुड नाइट।
हेलो
मदन सर, आप म्यूट है।
पवन जी, हमारी तरफ से बहुत बहुत धन्यवाद। आपने और वेरी टैंजिबल आउटकम की बर्नी साहब भी जुड़ा हमसे, बग्गा जी भी आए हमारे साथ, तो थोड़ा आगे करेंगे पांडे साहब से, थोड़ा बातचीत करके थोड़ा करेंगे, और अग्निहोत्री जी की तरफ भी देखेंगे तो कैसे ले चलें इसको देवभूमि की तरफ, थोड़ा इंटरेक्शन
जरूर सर।
कॉलेज वालों के साथ या हमारी पतंजलि वालों के साथ, पता नहीं वहाँ है योगा की मैडम है वहाँ, सो थोड़ा सोच के करेंगे जी कुछ।
वहाँ तो गढ़ है, ये तो पतंजलि योग पीठ ही है।
बिल्कुल
करते हैं जी।
बिल्कुल। सो थोड़ा इसको आगे ले चलेंगे। सो वंडरफुल, थैंक यू अंजलि, थैंक यू अनिता for joining and staying so late from in Malaysia, and we look forward to your guidance and inspiration for taking this platform forward. Thank you Anjali.
Good night
Domaji, namaskar, Shivratri. Agnihotri ji,
नमस्कार।
Shivratri. Thank you. Good night.